of mobile phones, as they will interfere with the recording equipment. Just want to advise members that table today is a new agenda. The Chartered Society of Physiotherapy had put in a request to present evidence to the committee today on the physiotherapy self-referral issue, which is agenda item 18. I just want to ask members of their content to consider the evidence prior to the session with the Health Board. I think it will provide an important context to the issue. Members content?
Yeah, great.
Thank you. Item 1, do members have any apologies? No, okay. Item 2, just under Chair's business. Just advising members, as you will be aware, the Minister made a statement yesterday on the establishment of the All-Ireland Congenital Heart Disease Network. I think it's certainly an important step forward, but there are issues, in my view, that need to be clarified. Specifically, the issue of the cost of the cardiology hub. I know the Minister had indicated that there was £1 million allocated through the Change Fund and an additional £200,000 through his own department. But can I seek agreement, members, that we would write to the Minister to clarify how much the cardiology hub will cost, and if all the money is in place, and if not, where the shortfall will be found. Members in agreement with that? Thank you. I also want to advise members that on the 11th of March, the HSE Change Day is taking place. Nikon has requested a photo opportunity with the committee to publicise the event. That will take place on the 11th of March at 1:45, either in the Great Hall or on the steps for members' diaries. Also advising members that the Executive's EU Priorities 2014-15 mid-year review now contains a target for all departments to update their committees twice a year on EU proposals impacting on the department. The committee has never received such an update, so I'm suggesting we do seek one now.
Great. Yep.
Thank you. Item 3, members, is the draft minutes of the meeting of Wednesday, 25th of February. Just referring members to the minutes, which are on page 6. Are members content?
Great.
Item 4 is the Food Hygiene Rating Bill, the evidence session with the Food Standards Agency, referring members to the Clerk's paper and the FSA proposed amendments, which are at page 11 of the pack. Just advising members also that the committee has considered the Hansard of the evidence presented by the FSA on the 11th of February and the correspondence received from the FSA since that meeting. We had discussed it at our meeting last week, and as a result we had agreed on a list of clauses that we think would merit further discussion with the FSA. So today, members, is the opportunity to discuss in detail the concerns that we have about the bill. We obviously, members, need to get as much information from yourselves, from the FSA as possible, because within the next number of weeks we have to make decisions on whether we're content with the FSA position or not, and if not, look to putting forward our own amendments. So, Michael and Catherine, you're no strangers to the committee at this point. You're both very welcome. Just to advise yourselves that we had, as I said, considered the Hansard of the evidence from the 11th of February and the correspondence received, and thank you for that. We discussed it last week, and as a result we have now looked at the agreed list of clauses that we think, as I said, would merit further discussion with yourselves. So I propose today to go through each of those clauses in turn. I'll ask you to comment, and then we'll open it up to members if they have any questions or comments. So we will then move into the next clause and so on. So that's the proposal for the way forward today. So straight into it, in terms of clause 1.7, I think it would be useful to have clarification on whether the power to amend the definition of a food business entertainment establishment can be done at any time or only after review of the Act. So maybe you could clarify that for us.
There are various powers within
the bill which allow changes to be made, one being the definition of a food business establishment, as in 1.7. The intention is that we would not always conduct a review before making such changes, because there could be situations in which information or evidence may come to light through other means that would give us what we would need to be able to say that there is now a strong case for taking this forward. It would also be a financial burden on the department, the FSA and on councils to carry out a review every time that we needed to make a change linked to these specific provisions. Obviously, whenever any changes would be being considered, we would be undertaking a full impact assessment and full formal consultation. Okay, so what I'm hearing is that it wouldn't always be the case to have to conduct a review? That's correct. Okay, so that is the current position. Do members have any comments on that or require any further information on that? Okay. Thank you. Clause 2.1. The councils were concerned about the requirement for them to notify businesses of their rating within the 14-day period in case there are exceptional circumstances, and I suppose this is the key issue, that would prevent them from meeting the deadline. You have certainly seemed to have taken this concern on board and are proposing an amendment to deal with situations where compliance with various timescales within the bill could be reasonable due to exceptional circumstances. I suppose the question is, could you maybe talk us through the detail of that amendment, which I understand is dealt with in a new clause called adjustment of time periods? Right. I suppose the question then would be, why have you decided not to define what constitutes exceptional circumstances on the face of the bill? So maybe if you just talk us through the amendment initially. Okay.
Yes, you're quite right. This has been the issue that the CHOG raised around needing some flexibility for exceptional circumstances has been put into effect by Amendment 26 in the total list of amendments. And as you mentioned, this would be a new clause entitled Adjustment of Time Periods. In that new clause, sub-clause 2 provides an extension of 7 days over the Christmas period. That's because we know that some of the councils would completely close for maybe 7 days, so it's just to, I suppose, really give them that period of time back. But sub-clause 3 deals with the issue that you have raised, and that's what we talk about, the exceptional circumstances. So where it isn't reasonably practicable because of exceptional circumstances for the District Council to comply with the 14-day period, they would need to do it as soon as is reasonably practicable. So what do we sort of mean by exceptional circumstances? What we're talking about are events that are very unusual and certainly not typical. For example, where a District Council might be required to investigate a very major food poisoning outbreak. So if I can just remind you of the E. coli outbreak that was associated with a restaurant in Belfast a few years ago. That was very, very significant, and it did require the Food Safety Department of the Council to divert their efforts to that for quite a prolonged period of time. It's not a common occurrence, but when it does happen, the impact can be quite major. Another instance that I could draw your attention to would be where the FSA, the Food Standards Agency, might request the District Council to do particular things. So again, taking you back to a few years ago with the horse meat scandal, that was a very, very big, high-profile incident, and we requested councils to undertake certain work. We asked them to conduct inspections of all their meat processing establishments under their control within a defined period of time to allow that incident to be managed and brought under control. So that was additional work which had a significant impact on their routine, usual, business as usual work. The councils themselves deal with issues that are outside their control. For example, we have flooding situations in Northern Ireland, and when that happens, all of the staff from the Environmental Service will be diverted temporarily to get those situations under control. They may have IT failures that might take a short period of time to put right, and there might be even issues that are completely outside both the District Council's control and the Food Standards Agency, where, for example, you could have a postal strike, and so the need to notify people within a certain period of times where they might do that by post could be affected. So all we're trying to do is to say in those very exceptional circumstances, the requirement isn't absolute. We would want to put that information down in the guidance, so we would clarify quite clearly in guidance what those exceptional circumstances would be. It does allow some degree of flexibility, so where maybe new exceptional circumstances would arise that we haven't seen before, that we could reflect that in the guidance rather than on the face of the bill.
I mean, but you said there as well that exceptional circumstances, and then you moved on to very exceptional circumstances. Well, surely it would need to be very, very clear. And I suppose my question would be, if a situation whereby there was a long-term sick absence, maybe within council's environmental health officers, is that exceptional circumstances?
It may be for a short period of time, and this is what it says, they must deal with it as soon as is reasonably practicable, but those issues, I think, are foreseeable. I mean, every department has to imagine that one or two people may from time to time go and take sick leave, and so that the department should have arrangements in place to pick up work in those instances. What we're talking about is bigger, more major events where, the resources have to be diverted for a period of time to deal with those larger issues, and we would detail that quite clearly in the guidance.
But I suppose the issue is then why you wouldn't have a definition of what constitutes exceptional circumstances on the face of the bill itself.
I think that it might be quite confining, and if something else then comes forward at a later stage to amend primary legislation isn't easy, and so I think we would like the bill to be able to adapt, as within parameters, to situations that we maybe don't foresee at this point in time, and that we could be very clear on what exceptional circumstances would be and put those situations which may change and alter into the guidance.
Yeah, but I suppose I would suggest that one person's exceptional circumstances may be very different to another's or an organisation's.
I mean, in the first instance, the idea is that the examples that Catherine has described would be contained in the statutory guidance to accompany the bill. In developing that guidance, we will obviously be engaging with the representatives from the district councils, and we'll be saying, here are what we believe to be exceptional circumstances. They're out of your control for one reason or another. And we will see through discussions with them if there's anything else which, from their experience, means that they know they wouldn't be able to address their obligations under the bill, and we would refine that list. We would then expect that if the district council came across a scenario which didn't fit with what we had detailed in the guidance, then they would liaise with us to see whether or not, in fact, that is an exceptional circumstance. But we think that we can build this list in agreement with the councils, which is about things out of their control, and we can ensure that they are only making use of the flexibility around time in those circumstances. Later on, we'll be talking to you about right to reply and the general powers of the agency and how we ensure that councils do things the way we expect them to do through other powers that we have related to audit. So again, in terms of any aspect of the scheme, to make sure that it's being operated appropriately, we have other powers that we don't need to put in this bill that will allow us to make sure that councils are behaving responsibly and in accordance with the statutory guidance.
So in short, do you think that the definition of exceptional circumstances on the face of the bill would be restrictive, and that you're prepared to look at that in terms of the guidance and will be offering up definitions?
Most definitely, yes.
Okay.
Just on that
yep, sure,
issue,
go ahead.
and I can fully understand, and Mickey the same, because we've had the same issues with the Welfare Reform Bill, and we've had lengthy debates in there where other parties were putting forward things that should be in the bill, but it made more sense to have them in the regulations, or guidance, because, and that's not only to protect this establishment, that's to protect the people that this affects as well, because it is much easier, as you say, then to change what might necessarily have been working well, or something better has come up, much easier to do it through regulations and guidance than it is to do it to try and amend a bill, which is extremely difficult. So I mean, some things, yes, we want to see on the bill, but others, I think that leaves us room for manoeuvre afterwards to say, is this really working out for the people that we're trying to help here? Do we need to change that? So
we're fortunate that in developing the first iteration of the guidance, that we can build on the experience of the operation of the food hygiene rating scheme since 2010. But the guidance will be very much a live document. We will review it just as frequently as that needs to be done, as and when something new needs to be included or changed or amended. It'll not be a document that is produced as a one-off and then we don't make sure that it is actually delivering what we need it to do.
Okay, and I mean, it probably leads on to the next point, which will be about monitoring and how, you know, how you would propose to do that, you know, how often that monitoring would take place, and for what reasons the councils and yourselves are relying on exceptional circumstances, you know, in terms of not meeting deadlines set out in the bill, and then how would you propose, I suppose, to monitor whether different councils are applying different definitions of exceptional circumstances? Can you clarify that? Or
again, going back to the point that I made about agreeing what constitutes exceptional circumstances at the start of the process, we do have regular engagement with the district councils. I mean, at the moment, we have set up an implementation group specifically to look at bringing the statutory food hygiene rating scheme into play. And that group will always have a role, as will the other liaison mechanisms that we have with the district councils, to make sure that, in essence, we have consistency in interpretation and application of any legislation, not just that relating to the food hygiene rating bill. We also have powers to audit the district councils, and clearly one of the things that we would be intending to do at an appropriate time after the scheme has been embedded is to conduct a focused audit of the district councils, specifically looking at how they are fulfilling their obligations under the Food Hygiene Rating Act and how they are applying guidance that relates to that Act. So we will be undertaking an exercise post-implementation to make sure councils are, in effect, doing what they're supposed to do.
okay, I mean, I suppose it's reflected in the guidance, is what you're saying. So therefore, it's not appearing on the face of the bill. There isn't a requirement then for a clause to look at exceptional circumstances being removed or amended as situations are redefined.
No,
in your view, the guidance is sufficient?
Our view is that we explain from the outset what exceptional circumstances are, and that we keep that under review in conjunction with the councils, with a clear expectation that if they think they've got a situation which doesn't fit what is in the guidance, then they should discuss that with us before deviating.
And if I can just add as well, some of the exceptional circumstances relate to the times the councils have to notify the FSA about certain things. And that's very easy for us to know because we maintain the website, so we know how frequently we're getting information from the councils, and we know those time periods have been exceeded. So it's very easy for us to look at those time periods through our IT software and identify where periods aren't being met, so we can then ask the question, why was the time period not met? Was it an exceptional circumstances, and what was it? So we will know in relation to those very specifically as they're happening. That will be timely information, regular.
Okay, and then sort of maybe coming at this from a slightly different angle, who monitors yourselves in terms of that monitoring process around exceptional circumstances?
Nobody would in effect monitor us, because in the world of food safety we are what's known as the Central Competent Authority for the United Kingdom. So if you imagine a pyramid, we sit at the top of the pyramid, and we have the responsibility to make sure that all competent authorities, including district councils, discharge all of their obligations under food law correctly and in accordance with codes of practice and statutory guidance that is put forward to ensure that the systems work as intended. There are times whenever the overall performance of a country is subject to scrutiny by what is known as the Food and Veterinary Office of the European Commission. But because this would be domestic legislation, this would not be an issue that the FVO would be interested in. So in effect, nobody would be checking what we are doing. In terms of how we operate as a government department, you will be aware that we're non-ministerial and independent, and one of our core values is transparency. So when we undertake any activity around audit and so on, all of those reports are published in the public domain. So we do make our findings known and easy to access so that others can see what we're finding and can learn from that where they need to.
Okay, in terms of clause 2.3, this particular clause specifies the information that the council must send a business when notifying of its rating. And councils had made the point that they sent some of this information well in advance of when they sent notification of the rating, and they wanted the clause to recognise that. I think you've taken that on board and again proposing an amendment to that to allow for some of the information to be provided at an earlier stage and the remainder to be provided within the 14 days as part of the notification of rating again. Just maybe talk us through that particular amendment.
So the way the current wording of the way the bill is currently drafted, it reads that all the information must, I suppose, be given to the food business operator at the same time. And quite rightly, the council's pointed out that that's not currently how they would work. So we have brought forward an amendment which would be effected through Amendment 1 on the list. The purpose is just to ensure the information that's listed there in clause 2.3 doesn't necessarily have to be provided all together at the same time. So if I can just give you an example, a council will inspect a business, and in some instances they may actually leave the report, which would cover points B and C in that list, at the time of the inspection. So they may leave a written report on the premises. They may then go back to the office and they will have some internal checks where other people will look at how they've derived the rating and agree that they have done it correctly. So the rating and the sticker and some of the other information about explanations of some of the safeguards would maybe come in a letter after that. So the wording in the amendment is really just to allow for those instances. The information will always be provided within a 14-day period, but not necessarily all exactly at the same time. And that's what that amendment does.
Okay, so it's really to allow for those particular incidents that you've outlined. Okay, do members have any comments on that particular clause or comfortable? Okay, clause 2.4 is the issue there, I suppose, was that the bill contains no timescale for councils to inform the FSA of a business rating, and that could mean that there is a significant time lapse or time lag in terms of businesses being inspected and the new rating being displayed on the FSA website. Again, taking that on board and a proposed amendment, just maybe a bit more detail in terms of the amendment.
Okay. Yes, so the amendment in relation to the timescales within which the councils must notify the Food Standards Agency of the rating has been put into effect by Amendment 2. And it requires the councils to inform the Food Standards Agency of a new rating within 34 days from the date of inspection. And that's a maximum period. They can do it earlier, but they have to do it within 34 days. And the purpose of setting this time is to enable then the FSA to publish the rating once the appeal period is over on the website. So it puts a framework around when the information would be published. It's quite important to say that the new rating will only be published online after the appeal period is over, and this is because during the appeal period, as we've discussed before, the food business operator can decide whether to display at their premises their new or their existing rating. So during that 21-day appeal period, we wouldn't necessarily know which of the two they would choose to display. So for this reason, during the appeal period, The existing rating will remain on the website, but then it will be updated as soon as the appeal has expired. So once a business has decided, I don't want to appeal, I'm happy with my rating, it'll pop onto the website. If they decide they do want to appeal the rating, once that's been determined and the FSA have been notified, then again that would pop onto the website. So you might be wondering why we've arrived at 34 days. Just to explain where that's come from, that relates to the 14-day notification period. So the point from when the business gets an inspection, then within 14 days they should have received their rating. And added to that is the 21-day appeal period, because within that period they have that time to decide if they want to appeal. And that gives you a total of 35 days. So we've really just taken 1 day off to make sure we get the information in a timely manner that we can publish as soon as it is the end of the appeal period. Yeah,
So it's a 14-day notification and the appeal process minus a day?
Yeah.
Okay. Members okay? No comments, questions on that? Clause 2, we're still on point 5, was the issue that the bill, again, the timescale for the FSA to publish a business rating on the website, and you'd explained that currently when a council notifies the FSA of a business rating, it's automatically uploaded, and you've referenced that on the website. And also accepting that there should be a requirement, you'd indicated that on the FSA in terms of publication, to maybe future-proof the legislation, as you know, we can all accept that IT systems can change and can be subject to change. So there's now a proposal for an amendment to that.
Yes.
So again, you're talking about an introduction of a deadline of 7 days after the end of the appeal period.
Yeah.
So maybe just a bit of reflection on that.
Certainly, yes. So this amendment has been brought forward by Amendment 4 in the total list. And as you've mentioned, it provides a new requirement on the Food Standards Agency to publish that rating online no later than 7 days after the end of the appeal period. As we have come and spoken to you before, we've explained that really in reality, if we get that information within the timescales that are on the councils now, the 34 days, it will actually appear immediately. So it will appear as soon as the appeal period is over. We probably won't actually need the additional 7 days, but it's in keeping with the provisions in the Wales Bill, and it does also allow for where there might be any slight IT technical difficulties, and I think we're all aware that IT difficulties can occur, and so that would be a reasonable amount of time to make sure that those were sorted out and to allow the rating to be put onto the website.
Okay. Any comments? No. 2.6 was about the format of the sticker. And again, there's an amendment proposed there, so maybe talk us through that.
Certainly, yes. So this has been affected by Amendment 6. And the wording has really just been enhanced to ensure that the regulation-making power already provided in the bill will allow for more than one form of sticker. So this is in response to the concerns that Seahog raised with you. The sticker should be available bearing council logos. So these amendments, the amendment details that the regulations would provide clarity on who would bear the cost of producing the sticker. So, for example, currently the FSA provides the generic sticker free to the councils to give to the businesses. Where the councils want to apply their own council logo, they can do that, but they buy the stickers themselves. And also this amendment, this would ensure that the forms of the sticker and who would provide the various stickers, it allows for that, and that we would explore that during consultation when we produce the regulations. And obviously at that time we would be seeking views from stakeholders around the issue of stickers and whether the logo should be applied, and who would bear the cost of those. So it's really just to make sure that regulation making power is wide enough to allow for that to happen,
Okay.
should stakeholders want that to happen.
Okay, members, have enough with that?
Yeah.
Clause 3, the pubs of Ulster had suggested that there should be what was called a grace period after an inspection to allow businesses to, I suppose, remedy or fix any issues that had been identified. You had previously advised the committee that you were opposed to the idea of a grace period because it goes against the purpose of the scheme, and you very clearly saw that as encouraging self-compliance by businesses, and that you had thought that businesses were, if they were allowed a grace period to fix issues, there would be no incentive for them to continually maintain high hygiene standards. Now, we have discussed this further, and we understand as a committee the arguments on both sides, I think it's suffice to say. But can you maybe talk us through your rationale for not providing that grace period?
This is one of the most difficult issues that we have to deal with, and I'm going to take some time really just to try and go through this in detail to give members a good appreciation of why we have so much opposition to this particular suggestion. The first thing I'd like to do is just to take you back to what it is we're trying to achieve through the scheme. The purpose of the Food Hygiene Rating Scheme is to provide meaningful information to consumers about food hygiene standards and help them make informed choices. And this in turn provides the incentive for businesses to achieve and maintain compliance with food law and to produce safe food. The fact that the scheme, as designed at the moment, promotes self-regulation has proved to be a massive benefit to district councils, because most businesses now want to comply and have raised their standards. And this in turn allows the district councils to focus their resources on the worst businesses that are not taking their obligations to comply with food law seriously. So, in terms of how we got to the policy position within the bill, bearing in mind where we started with a voluntary scheme, you will be aware that we conducted a 12-week consultation back between February and April 2013. This was widely distributed to all interested parties, and we organised briefing sessions to inform stakeholders of the consultation. In this instance, we held one with the enforcement stakeholders and another specifically for the food industry, and arranged a number of one-to-one meetings with interested parties. So we afforded lots of opportunities for people to come round the table and to talk and discuss the policy that we were putting forward, that was based on the voluntary scheme, which we know works and delivers the policy objectives.
Chair, sorry, just for clarity,
go ahead, George.
although pubs of Ulster, that includes hotels, restaurants, is that correct? Hotels,
Yes.
restaurants.
I was just going to go on to the fact that
Sorry.
in response to the consultation we received 29 responses. This was outside the sessions that we had to discuss around the table. Of these, there were 5 came from trade associations, including Pubs of Ulster. And in their response to the consultation, there was at that point in time no suggestion of a radical change to the scheme, such as a period of grace. Within the responses, there was an overwhelming support for the appeals mechanism. And you may recall that Pubs of Ulster were talking around this period of grace possibly replacing an appeals mechanism because of a reluctance on the part of some businesses to use appeal. Through the consultation, it was very clear that industry do support the concept of the appeals mechanism. And the biggest issue there was the fact that in our initial policy position, we were only proposing 14 days in which to make an appeal. Now, the policy was revised in light of the consultation, and indeed when the bill first came before you, that had been moved to 21 days. So we had already responded to industry around the length of time for an appeal. The other issue that was discussed that's relevant in the discussions with industry and with the enforcers was the issue that under the voluntary scheme, you can have to wait up to a maximum of 6 months before you can get a re-rating inspection carried out. And that's in essence because we have what's known as a 3-month standstill period. Once you've been notified of the rating, no matter what you do to improve conditions under the voluntary scheme, you can't even ask for a re-rating inspection for 3 months. And then the councils have, under the brand standard, a further 3 months to conduct that. So in the voluntary scheme, you have that sort of 6-month window. Now, industry were very concerned about this in the context of a scheme where they were going to be required by law to display their sticker, particularly if they had done the necessary work to improve conditions. This was an issue that the District Council representatives felt very strongly about, and we had several meetings with the Chief Officers Group, who were very robust in trying to maintain this 6-month period in order that they could be satisfied that when a business did take the necessary action, that it was properly committed to changing its ways and had secured long-term improvements. But we did recognise the point that industry made that this could be potentially damaging in the context of having to display their sticker. And we agreed a compromise position that the standstill period would be taken away of 3 months, and that they could request a re-rating inspection that would be carried out within 3 months. So in effect, we halved the period of time that any business would have to wait before they could get a new rating. This was quite difficult for the District Councils to accept, but the reason for flagging it is that I wanted to make it clear that on this issue, which is fundamental to industry, there's already been significant compromise in getting to this position. Just to flag again, in relation to the numerous meetings and discussions we had with stakeholders, those who came to the table were able to see how the current voluntary scheme and the basis on which it operates delivers and the rationale behind it. So everyone came trying to refine the policy proposals, and we didn't at any stage receive any suggestions about doing something radical, such as a period of grace. So I just want to make it clear to committee that this wasn't an idea that had ever been discussed before, and the first time it came to light was whenever Pubs of Ulster suggested it to the committee earlier in January. So the stage at which this has been tabled means that there's been no opportunity for other stakeholders to be consulted on the principle and indeed the wider implications that it would have for the scheme. If we then look in a little bit of detail about what this would actually do to the scheme, firstly, it's actually very difficult to understand what has been proposed by Pubs of Ulster because there's a lack of information as to how the concept of a period of grace, as suggested, could operate in the context of the provisions of the bill, specifically that in Clause 3 for appeal and also Clause 4 request for re-rating. It would appear to us that in proposing a period of grace, Pubs of Ulster has conflated both of these issues into one issue. And it was suggested to the committee that the period of grace should replace the provision for an appeal. But what we are clear on is that such a mechanism could not replace either the appeal in Clause 3 or the request for re-rating in Clause 4. And the reason for saying that is the appeal provision provides a mechanism for the food business to challenge incorrect decision-making. A period of grace where you would be accepting the findings of what an officer said and putting things right is very different. And there are those, we need to make sure that there is the provision to challenge where what the officer has said is, in your eyes, incorrect. Secondly, we need to bear in mind, and I'll be coming back to this in some detail later, that if you had a period of grace where after 6 weeks the business that hadn't been found to be very good on the day of inspection and hadn't got a 5 was being inspected after a period of grace, it's highly unlikely that the business would on that occasion be able to get the top rating, even though it had put things right, and I'll come back to that in some detail. But the reason for flagging it here is to make it clear that, because of that, the re-rating provision that is currently in Clause 4 would still also be required. So this idea of a period of grace cannot get away from the fact that there is a sound rationale and would still be a rationale for both appeal and for re-ratings. If we look then more fundamentally at what a period of grace would do to the scheme, the bottom line is that it would result in a scheme that does not meet the primary policy objectives. In the current scheme, the voluntary scheme, and the principles in which we're proposing to bring forward through the bill, the incentive for businesses to comply with food law comes from the fact that if they don't do what the law requires them to do, they will be forced to display a poor rating. This is a fundamental aspect of the scheme. A period of grace would entirely remove this incentive and would drive perverse behaviours where an effective business would only put things right whenever they've been told to do so. Now, I'm not suggesting that all businesses would act irresponsibly and take that attitude, but quite clearly we know there are businesses who at this point in time, for one reason or another, do not comply, and it is perfectly reasonable to expect that they would adopt that sort of behaviour. We've also got to bear in mind that the law requires food businesses to comply on an ongoing basis, and the real achievement of the Food Hygiene Rating Scheme is that it provides the incentive to do this. We're now in a position where 87% of businesses in Northern Ireland are good or very good, and a further 10% are generally satisfactory. And our research has demonstrated that the Food Hygiene Rating Scheme has played a key role in achieving this. So we know that the mechanism that we have at the moment, whereby there is the incentive to comply, and there will be a motivator to continue to do so, is effective in maintaining standards of hygiene and ultimately in ensuring that businesses produce safe food. So, if you look at the current scheme, I don't know when, I've got a food business and I don't know when the food safety officer is going to come to inspect. But I know that if I haven't got my house in order, I'm going to be forced to display this rating, and it's potentially going to do my business harm. So I have a motivator to say, well, actually, it makes more sense for me to try and keep on top of these things and be sensible and run the business in accordance with the law. And then whenever that inspection happens, I won't have anything to worry about. I will get a good rating, my business will not be damaged, and things will be good. If we look at it from the perspective of the consumer, the reason that we're looking for the mandatory display of stickers is to provide consumers with meaningful information. And it's our view that introducing a period of grace would completely devalue the scheme, because a rating that was only determined following action or intervention by the District Council would not be a reflection of how the business is actually managing food safety on a regular business day. So it's at least very questionable whether consumers would consider such a rating to be meaningful information if it was only prepared after a business is allowed 6 weeks to fix its failure to comply with the law, which is an ongoing one on a day-to-day basis. If you then think this through logically, the next repercussion is that it would result in a lack of transparency for consumers, because the worst ratings based on unannounced inspections would never actually be displayed. So consumers would never actually know how a business, without the intervention of the District Council, would be performing. They wouldn't see the bad ratings. They would disappear. So we would no longer have a scheme that provides meaningful information for the consumer. And indeed, if you think that through to the next step, it would actually bring in to question the merits of having a 6-tier scheme that we currently have, moving from urgent improvement to very good. The other thing related to the consumer is that if you had a 6-week period of grace, it would have a significant impact on the length of time that consumers would not have accurate and up-to-date information about hygiene conditions at establishments, because this would add 6 weeks to all of the other time-bound requirements in the bill. So, for example, you'd then be talking about 8 weeks from the time of the initial unannounced inspection before the business's new rating would be available by way of the sticker, and then potentially another another period on top of that before it would appear on the website. So that's the impact it would have on consumers. If we then think about the impact that it would have on district councils, and I'll make no apologies for speaking on behalf of district councils here, having the benefit experience of enforcement and working with colleagues throughout food hygiene rating from it was first devised as an idea. The idea of a period of grace would be totally unacceptable to district councils for a number of reasons, but primarily because the scheme would no longer provide an incentive for businesses to comply on an ongoing basis as required by law, which is what the current scheme has very successfully delivered since it was introduced. The fundamental concept of producing and publishing ratings that are determined based on the findings of unannounced inspections has proved to be a very significant tool in driving and maintaining compliance by food businesses. And this is what makes the scheme of value to district councils. The current approach has had a very positive impact for the councils in that they do not need to inspect good businesses as frequently as they would have done when they weren't complying. And this allows them to target more resource to deal with those businesses who persistently fail to comply with food law. And this is an increasingly important point in a context where councils are going to be facing increasing financial challenges. Fundamentally, the fact that the scheme is driving standards up with the motivator to self-regulate is good for the safety of consumers. If we look then at the practicalities of a grace period, there are certain things that really we can't be certain about how it would work, because the proposal that has been put to the committee is an idea without detail. So, for example, we don't know whether what was being suggested was that any business, apart from any business that didn't get a 5 on the day of the unannounced inspection, would every business have to get a revisit after 6 weeks at the period of grace? Would that be an automatic right? If it wasn't to be an automatic right, how would that work with the provisions in Clause 4 for re-rating inspections? If it was an automatic right, clearly that would have massive impacts on district councils and would divert scarce resources away from conducting their planned inspections, which is critical to ensuring that businesses are complying and that the public are being protected. But it would also present a burden on businesses if they were automatically required to get a further inspection. The other thing that, again, that there is no detail on is whether or not industry would be required to pay for these inspections at the end of a period of grace, similar to the proposal that we have in Clause 4, whereby businesses will be paying for the re-rating inspection. We weren't exactly clear about whether Pubs of Ulster were in fact talking about a 6-week grace period, because at times when they were presenting to the committee, at times they referred to 21 days and 6 weeks. But if we assume that is the longer of the two, a 6-week period, that in itself, a 6-week period, would not always be sufficiently long to allow food businesses to put right all of the things that were found to be wrong at the time of inspection. If it was something very minor, obviously some things can actually be fixed just like that, sometimes before the officer even leaves the building. But if, for example, the business had to address significant structural work, had to source new equipment that would have to be delivered and supplied, or, for example, food hygiene training was required that had to be delivered by an external provider, 6 weeks would not, in many cases, be sufficient time to allow that to happen. Fundamentally, we believe that it would not be a sufficient time in which to demonstrate that changes to food safety practices and procedures have been properly implemented, and that the business has demonstrated sustained commitment to improve practices and management of these on an ongoing basis. So going back to the point I made earlier about the concession that's already been made to reduce the re-rating period from 6 months to 3 months, if we were talking about a 6-week period, I am certain that the district councils would find that extremely unacceptable on that issue alone, never mind the approach that we have at the moment, never mind the impact that conducting all of these inspections would have. Finally, on that point, I would like to highlight that the re-rating provision in Clause 4 of the bill works on the basis of a request. And it's up to the business to decide when the time is right to make the request, depending on how long it knows it will take to put things right. So this approach that's already within the bill minimises the burden on re-inspections on district councils and on the businesses. And this seems sensible to us. I'd now like to deal with something that goes right to the very core of this, as to why, if we use the current scoring mechanisms for the food hygiene rating scheme, that a period of grace would not work. And what I'd like to do is take you back to the visit that we arranged for the committee to the kitchen here in Parliament Buildings, and the explanation that we provided about how a food hygiene rating is actually calculated. So you'll recall that there are 3 elements of the intervention rating system in Annex 5 of the Food Law Code of Practice that are used to calculate food hygiene ratings. One of these elements is called confidence in management. And this is where the officer is making a judgment on the likelihood of satisfactory compliance by the business being maintained in the future. Now, several factors are taken into consideration when scoring this element, but a fundamental one is the track record of the company and its willingness to act on advice and enforcement actions. This is the element that means a rating is not just based on the findings on the day of inspection, as has been suggested by Pubs of Ulster, and in fact that compliance over time is being taken into account in producing the rating. So if we look at the situation where a business was not proactively complying with the law and it was waiting to be told what to do when the food safety officer came along, which is what could happen with the period of grace, this would result in a poor score for confidence in management, even after the 6-week period of grace, because the 6-week period isn't really relevant to the confidence in management score. The confidence in management is about how the business was being run whenever the inspection was carried out and the history in the period in the run-up to that. So what this in fact would mean that at the end of a period of grace, it would be virtually impossible for a business to achieve a score of 5, because the limiting factor would be the score for confidence in management. Your hygiene may have improved, your practices and procedures may have improved, and your scores there could have moved to 5 or indeed 0. But the chances of you getting a score of 0 or 5 for confidence in management just wouldn't be possible because of what confidence in management is. So this is really going to the very core of the scheme and why, as a concept, we believe that it would not work. You would end up having to, if you wanted to bring this type of approach in, you'd have to rebuild the complete scheme and have a different way of rating the businesses and working out the scores. We've also got to remember that there are those businesses who take their obligation to comply with food law very seriously and behave responsibly on an ongoing basis. And they value the fact that, this results in them achieving a good rating that they can proudly display and use to commercial advantage. If there was no incentive for businesses to comply, as would be the case with period of grace, then those who currently comply, some would be less likely to do so in future, and the scheme would become pointless. We've also got to remember that many businesses spend a significant amount of money to ensure that proper hygiene standards are maintained and that food safety is properly managed in their business. A period of grace approach in which some businesses who do not put in the effort to comply until they're told to do so by the food safety officer would therefore be unfair and unacceptable to responsible businesses. So, to conclude on that point, hopefully that has given you an insight as to the complexities and the difficulties that exist around the period of grace. Where it would take us to, if you were to bring it in, would be that we would end up having to have a hygiene rating scheme that was operating on a basis so fundamentally different to those that currently operate in Northern Ireland, England and Wales. We would have to completely redesign the scheme, we would have to rebrand the scheme, and ultimately the food hygiene rating scheme as we know it would not have the same meaning as the current FHRS does across the 3 countries. When you see the sticker with the number in England, Wales or Northern Ireland, irrespective of whether it's a voluntary scheme or a mandatory display scheme, it means the same thing to the consumers. So we don't think that this would be good for consumers if we had to have a totally different scheme in Northern Ireland, because again our research has demonstrated that the awareness of the current scheme is high. Consumers can easily understand it and value it, and it can be used across the 3 countries with confidence that it's providing a consistent and meaningful message. So finally, at this stage we would not propose to bring forward an amendment to introduce a period of grace or indeed further compromise in this aspect of the scheme, having made clear that compromise has already been made as regard the period for a re-rating inspection. And because this goes to the very heart of the scheme and would in effect pull the scheme apart as we currently know it, we would suggest that it would be necessary to engage with all stakeholders who would be impacted before it would be possible to get to a position of change on something of this nature.
Okay, thank you. I mean, that's been very detailed. What I'm hearing is that your view around the introduction of a period of grace would be wouldn't meet the policy objectives.
That's correct.
Of the bill.
Yes.
And ultimately that it would sort of provide not the challenge function, if you like, that would be provided for in an appeal.
That's correct. The appeal is a very different thing and would still need to be there.
Okay. Okay. Now you've been very, very clear on it, and it's very useful. Do members have any comments on that clause, or need any more information? Okay. Clause 3.6 is, again, you had suggested an amendment which required the Council to inform FSA of the outcome of the appeal or an appeal, or if the appeal has been abandoned. It also specifies that if the rating has been changed as a result of the appeal, the FSA must publish the new rating within 7 days online. We've touched on some of this, so again, maybe just briefly talk us through the amendment.
Yes, so it's been put into effect by Amendment 7 on the list of amendments, and it does follow on from what we discussed around Clause 2.5, and it is in effect to ensure that the FSA can publish ratings, speedily and as soon as possible. So this amendment places a requirement on the FSA to publish ratings online no later than 7 days, but to do that, they would need to have received the information from the councils. And the amendment proposes that within 21 days, at the same time that the District Council notifies the operator of the decision of the appeal, they would also let the Food Standards Agency know. And if the rating has changed as a result of appeal, then the Food Standards Agency would publish that within a 7-day period.
Okay, fair enough. Members comfortable enough, or need any more information? 3.10 then is just in terms of, I think it'd be useful just to have clarification on whether the power to provide for an appeal to be determined by a person other than the council which produced the rating can be done at any time or only after review of the Act. Maybe just clarification on that.
In terms of how we would first attempt to address any issues around how the appeal mechanism works, we would be conducting a review, and this is one of the provisions within the bill where we said we will conduct a review to determine whether or not appeal mechanism is working as possible. But again, going back to the point that I made at the start, it wouldn't necessarily on all occasions be a review, because we may be able to gather information about the appeal process working through a different approach on a more informal basis. So the bottom line is that we will be conducting a review in the first instance in accordance with the legislation, but post that we wouldn't always want to be tied to having to have a review to change that mechanism.
So it's similar to the clause 1.7 that we looked at, that it's not necessarily a review.
Exactly the same, yes.
Okay, okay. Any comments on that? Are we comfortable enough? 4.3. Again, proposal for an amendment to clause 4.3 to require a council to notify the FSA of the outcome of a re-rating within 34 days. It will also then require the FSA to publish the new rating online within 7 days of the end of the appeal period. It mirrors the arrangement obviously in clause 2. And maybe just briefly your rationale for that amendment.
Yes, so as you've said, it mirrors that in clause 2. So the amendment to require the council to notify the FSA of the outcome of a re-rating has been put into effect by Amendment 9, and it just replicates those requirements in clause 2 by inserting 2 new sub-clauses, clauses 4A and 4B. And it's exactly the same time periods as are detailed in clause 2. So within 34 days they would notify us of the new rating, and then again the FSA would publish within 7.
Okay, clear enough, members, yes. Clause 4.10, again, just useful maybe to have clarification
on whether the power to limit the number of re-ratings can be done at any time, or again, the issue about after review of the Act, or is it similar?
It's exactly the same. Yes.
The same. Okay, thank you. 5.2 is that, again, the clause sets out the arrangements for a food business establishment to make written reply in relation to its rating for publication on the Food Standards Agency website. You're proposing amendment to clause 5.2 to specify a time period of 21 days in which councils must deal with a right of reply. Again, just a sense of that proposal for the amendment.
Okay, this is affected by Amendment 13, and it requires the council to deal with right of reply and notify the FSA within 21 days. And the reason here that we've gone for 21 days is that we consider that to be a reasonable time period in which to consider a right of reply. It may be necessary for businesses to be visited, to have a discussion with the food business operator. It could take a bit of time to set that up. But ultimately, the 21 days is consistent with the time period for considering an appeal. So that's why we've gone for 21 days.
So it's consistent with the appeal process?
That's correct.
Okay, I'm assuming members are comfortable with that clarity. 5.3, again, arrangements for the food business establishment to make the written reply in writing in relation to the rating for publication, again, on your website. You're proposing an amendment, clause 5.3, to specify a time period of 7 days in which the FSA must publish a right to reply. You're also proposing an amendment which ties publication of the representations to publication of the rating. Again, just a sense of that from yourselves, please.
Again, consistent with the other obligations on the agency to publish the rating within 7 days, we've gone for a similar period of 7 days for the publication of the right to reply. But to flag that in normal circumstances and with the current technology that is used, it will happen virtually as soon as it has been received by the Food Standards Agency. Amendment 17 provides some additional clarity to confirm that a right of reply representation would only be published once the rating to which relates itself has been published. So we can't have a situation where you're trying to publish a right of reply before the rating itself has been published. And just to explain that, an inspection may have been conducted at a business which resulted in a new rating of 3, and the FBO, Food Business Operator, provides a right of reply to the Council for publication. The 3 rating won't actually be published until the appeal period has expired. So during this period, the right of reply can't be published. But once the rating is published, the right of reply would also be published. So that's what Amendment 17 is doing. It's ensuring that we're linking the right of reply to the rating that it relates to. It's just keeping those two things joined together.
Okay. Members content with that. Clause 5.5 then, there was questions in relation to clauses 5.2, B and C, which had given council powers to edit representations before forwarding them to yourselves, or to refuse to send them to the Food Standards Agency in any form. And I suppose the committee were concerned that those arrangements would mean that the FSA, obviously as the ultimate owners of the scheme, would not be aware of when representations had been edited or when councils had decided not to send them on. And as a result, the FSA would not be aware of any patterns emerging in relation to particular councils. You've identified again a drafted amendment to clause 5.3 to require councils to inform the FSA when they edit a representation or decide not to forward it on. However, I do understand from your letter of the 26th of February it was, that you did want to discuss this further with the committee, and so maybe I'm just thinking if you could talk us through or outline your current thinking on that.
You're correct in that Amendment 13 is currently drafted, provides for a new clause 5.2, and the new elements are in 2BC and 2CB, and this would require councils to notify the council when they edit or refuse to send a right of reply to us. However, when we have thought about that, we don't actually believe that that is a necessary provision. and I'd now just briefly like to explain why we think that's the case. Firstly, we trust district councils to discharge all of their statutory obligations in a responsible and reasonable manner, including implementation of the food hygiene rating scheme as currently specified on the brand standard. But most importantly, as I mentioned earlier, we already have the power to audit district council performance under the Food Standards Act 2000, the primary legislation that created the Food Standards Agency. So at any time, we have the power to check what a council is doing and how it's applying any scheme or legal obligation that they have. So we don't actually see the need to draft a provision that would place a burden on district councils where the power to gather the information already exists. And as I said earlier, it is our intention to conduct an audit in due course that will focus on the operation of the food hygiene rating scheme to ensure that it is being implemented in accordance with the Act, associated regulations and guidance. I'd also like to point out that the brand standard, which currently governs how the councils go about their business on FHRS, is clear in the circumstances to which the text of a right to reply should be edited. And that's namely in order to remove any offensive, defamatory, clearly inaccurate or irrelevant remarks. That's when they edit. Okay? If the text is edited, a copy of the revised text has to be provided to the food business operator who made the right to reply, and the district council has to provide an opportunity to comment on this prior to publication. So in terms of any amendments or editing of a reply or a refusal to publish a reply, there is transparency around that, and the food business operator always knows what's going on. And we had envisaged that the guidance that is currently in the brand standard would be replicated in the statutory guidance for the scheme. And to strengthen that, what we could also do is include a requirement within the guidance that before a decision to edit or refuse to forward a right of reply to the FSA is made, it must either be discussed or approved by the line manager or the head of service who is responsible for the officer making the decision. So within the guidance, we could build in an additional layer of control to make sure that the decision making is correct. We've also got to remember that the bill already requires councils to fully inform the food business operator of a decision to edit or refuse to forward a reply to the FSA. And although this safeguard is little used under the voluntary scheme, in the event the food business operator is unhappy about the decision, there are existing remedies for the operator to address this issue. So if the operator thinks that, well, actually, that comment I made wasn't defamatory and I don't see why the council have taken that out and I don't agree with it, there are mechanisms that are available. They could make a complaint under the District Council's complaint procedure, or indeed, if they felt so strongly about it, they could consider a judicial review against the council for abuse of process. Clause 14 requires each district council to keep the operation of the Act in its district under review. Now, guidance on this requirement, specifically around right to reply, could be included in terms of the guidance. We could also include it whenever we conduct the review that we're obliged to carry out, and we could look at how the right to reply provision is being implemented, and we could at that stage identify if there were any issues. District councils have to have internal monitoring practices in place to ensure that service delivery is in accordance with the Food Law Code of Practice and other relevant guidance. So again, in terms of the monitoring that goes around all of the activities to make sure that the job has been done correctly, decisions on right to reply could be included in these practices, and this could be written into the council's procedures. So finally, whilst notification of such actions would make FSA aware that the action had been taken, there is no power within the bill to require the FSA to take action against the District Council. So even if we required them to give this information to us, there wouldn't be anything that we could actually do about it. But the existing powers available allow us to monitor the council performance and address any issues of concern. So we're quite confident that this is not something that would likely be abused by councils, and we would be capable of finding out what is happening, even though we wouldn't require them to tell us every time they edited or refused to send us. So in effect, we would prefer not to be proceeding with those two amendments, 2BC and 2CB, in Amendment 13. And if that was the way we were moving forward, Amendments 15 and 20, which are consequential to Amendment 13, would also not be required.
So effectively, you're saying that the existing powers available would allow for the appropriate monitoring and, I suppose, protect against, it's your view certainly, that councils wouldn't abuse,
yes,
or wouldn't be in a position to abuse.
I mean, what one simple way of looking at this is, if a food business operator feels sufficiently strong about making a right to reply, the council will deal with that in a responsible manner, because if someone has raised this as an issue, they're not going to let it disappear. They won't be able to forget about it. They won't be able to say, oh, we're not publishing that. And indeed, there'd be no motivation on the council to do that. And with the clear guidance that editing is about defamatory, inaccurate remarks, then once those have been removed, and it is right that those would be removed, the responses would be published. Fundamentally, internal checks and monitoring, and we can detail again this in guidance, within the council, and our audit function and monitoring of the performance and review of the scheme give us sufficient mechanisms that we don't think we need to put this additional burden on councils on the face of the bill.
Okay, any comments or clarification required? Okay, members comfortable. Clause 6(4), it would seem to be the proposal for the amendment, sorry, is, it would suggest anyways, because of the end of the appeal period is now covered in the amendment to clause 2. Would that be correct in that? Okay. Okay, just to clarify that, and members are clear on that. Clause 7, committee members had raised concerns about this, that the bill does not require businesses who have a website to display their rating on it, and you will be aware of this. We've discussed this issue at length, and we do want to hear more detail around the rationale for that.
Okay, so I'm also going to refer later to this, just pointing it out now before I start, and I think you've all got it in front of you. When this issue was raised before the committee previously, we explained that the bill, as currently drafted, is designed to fill the gap within the current voluntary scheme in requiring food businesses to display their ratings at their establishments. And as members are aware, the Food Standards Agency do currently publish all the food hygiene ratings for businesses that are in scope of the scheme on the Food Standards Agency's website. And we would be of the view that when consumers are making an online food purchase, perhaps on their computer or their laptop, their tablet or even their phone, they will have access to this information, and that will either be directly by going onto the FSA's website or through many apps that are now available and provided by third parties. Now, when doing this, we do accept that the ratings may not currently be visible directly on the web page, but it is easily accessible and it's a few clicks away online. And this is clearly not the case, though, for a consumer purchasing food at an establishment, because where the rating is not displayed, it's just not there. And it's this gap that the bill, as currently drafted, is trying to fill. In considering whether to require operators to provide their rating online, a fundamental question that needs to be asked is where on the internet would we be requiring ratings to be published? And I think in considering this question, it needs to be considered how businesses actually use the internet, and that this can be quite complex and quite multifaceted. So just for example, you will have some businesses that have an official website, and they may offer online food ordering facilities on the website, so you can purchase your food there. You may also have food businesses that still have an official food business website which promote their food business, but they don't offer online food ordering facilities at the website, so would it also go there? Smaller businesses and other businesses now are increasingly using some of the social media channels to advertise their businesses. So we can see this quite often on Facebook. Would the rating go there? And then we now have third-party online providers who offer the services of many businesses together. So, for example, there are now a raft of takeaway sales websites such as Just Eat, where the consumer can go on and order food online from many outlets in their area. So again, would the rating go there? And we have third parties that compile directories of businesses. So there will be instances where food businesses might not actually even be aware that they have an online presence, where that information is being compiled generally on businesses in an area. And I think we also just need to take into account that the internet is changing all the time and how people use it. And there is an increasing trend towards the use of the social media channels to market and promote services. So we would need to consider how we would future-proof any requirement that sat in a bill to reflect the fact that this environment is changing quite quickly. So members have asked for some further clarity on possible technical or other difficulties that would be presented if the bill required online publication of rating. And in addition to that question posed initially, where are we talking about on the internet? Some other issues exist, and these have come through from persons who have responded to the consultation in Wales and from Welsh Government officials. And what they've told us is that the internet sales part of their websites are generic and they contain the information consumers need to decide what to buy, but the delivery itself will generally come from a local large store where the goods will be selected for delivery. So in other words, the consumers would need to know which store the products were coming from, but even on any given day this could actually change depending on the demands within the business. And how would meaningful ratings then be made available in those circumstances? For some businesses, the order may actually be coming from a warehouse or a distribution system rather than from one of their consumer stores, and that would not be in scope of the scheme and therefore it wouldn't have a rating. Multinational retailers operate one online ordering facility across the UK, and during the consultation in Wales they put forward comments that the Welsh Government could be exceeding its powers by introducing a website requirement that would apply to companies with websites relating to food premises outside Wales, as well as them having companies or businesses within Wales. And again, the same question would need to be answered for Northern Ireland. When ordering food online, the transaction may not actually take place within the jurisdiction of Northern Ireland. And again, would the requirements of the Northern Ireland Act then extend in those circumstances? And on what page would the rating appear for it to be useful? So some of the websites are very large and they may have many, many pages, and it wouldn't be proportionate for them to expect it to put it on every page. So where exactly within even a food business's own website are we talking about? The other really big challenge that we see for online publication is around enforcement of it. And it would be resource intensive for district council officers to police. I mean, they would in the first instance need to determine whether a business had an online presence. And an official website, as I've said, it could have multiple pages, so it could require some resource to check through all the pages to ascertain if the requirement was being complied with. And we know district councils wouldn't have the resource to carry out these additional checks. And in fact, we wouldn't want it to divert from their planned programmes and from the work they do in poorer complying businesses. So unless significant resource was put into policing the requirement, there is a potential for lots of online ratings to be out of date, and this could ultimately undermine the scheme. There would need to be mechanisms to ensure the ratings were kept up to date and that they were reviewed in a timely fashion so there weren't misleading ratings out there for consumers. So again, we'd need to be thinking about what time frame would be stipulated whereby businesses would be required to update any ratings they had online. In conclusion, from the current position in Wales, Welsh Government officials concluded that the resource required for district councils to enforce the provision would be disproportionate to the benefits gained. So we, when we had come before you previously, had proposed that an amendment be tabled that would require the Food Standards Agency to continue to do more to promote the scheme, and we think this would have a number of effects. So the promotion would be aimed at consumers, and it would inform them of the scheme, not just around the new issue of the mandatory requirement to display ratings at establishments, but also to promote the use of the Food Standards Agency website when people are making online purchases. And we have already been doing a lot of work in this area over the last number of years. So to give you an idea of the kind of promotion we're talking about, we've put together a timeline which everybody has, and it shows some of the promotion that the Food Standards Agency has taken forward since the scheme was launched in 2011. So when the scheme was launched, we did do quite a large publicity campaign with television ads, which some of you may have seen, and billboard posters, and that was very successful. But we've carried the promotion on since then, and what you see in front of you isn't everything we've done, but it is an example of something that we've done every year. So we've had poster campaigns, and increasingly we're moving very much to promoting the scheme through social media. And you'll see down at the bottom some of the campaigns that we've had, and most recently that was at Valentine's Day, where we did quite a lot of social media promotion of the scheme. The Food Standards Agency does now make ratings available through open data, and we would continue to do that. And that is to allow third parties to download the ratings and to use them in apps and other ways to continually make this information more easily available to people when they're online. The FSA would also continue to work with third-party providers to encourage them to use the ratings when food is sold online. So, for example, we have already worked with Just Eat, which is an online takeaway ordering service. Members can go onto the website, they can identify the area they live in, and they can select particular types of takeaway they're interested in, and then they get lists of premises that they can order from. And on every business page, there already is a link there that says, to find out the food hygiene ratings of the establishment, click the link and it takes you directly at that point through to the website. So businesses and third parties are already using this information and are already doing this, and we will continue to work with the new providers that come onto the marketplace to encourage them to do the same. And we'll continue to provide toolkits for business which provides them with the necessary artwork and branding to enable them to use their rating on any promotional material that they have, but also whenever they have an online presence. So we'll continue to give them the information they need to do that. So really, just to conclude, if committee members think that there should be a requirement for mandatory online ratings, then we do think it would be a good idea and would suggest some further consultation with stakeholders just to fully assess the costs and benefits and to seek agreement on really questions that have been raised to us from those stakeholders. They have maybe more questions themselves around how the detail of the proposal would work in practice.
Okay. Pam had indicated on this.
Yeah, thank you, Chair, and apologies for being late. Obviously, I've raised this a number of so far, and I understand the complexity of the whole issue, but I would still personally be of the mind that actually it's almost unfair that some people or some companies or some food outlets may effectively not have to pay the rating because they operate online, or it's maybe predominantly online, or maybe half their sales are online. I don't think that's very fair on the consumer who's ordering online, that they don't have the same access to that rating. But I do understand the complexities and all the issues are there, and that's why I wonder if we looked at even the prospect of simply having the link to the ratings, so where you're not actually saying even the rating, but saying, here's a link to the rating, and then that will take you to your site where, whether it applies or not, that information would be got from your site. Would that not be an answer to this query, rather than kind of on the baby out with the bath? What I'm saying, it's too complicated, we can't do it.
It would simplify some of the technical difficulties that Catherine explained, but I don't think that it would get around the issue around the businesses which operate, for example, on a UK basis and where the decision may be made outside the jurisdiction of Northern Ireland, where the actual food is being supplied from. It's still going to be very difficult to be able to provide very specific, meaningful information and not step outside what would be legally acceptable for those companies that are trading on a UK basis.
But in those cases, could you not simply have, instead of coming up a rating 0 to 5, no rating available or not applicable?
I think the point I'm trying to make is that for us to make any requirement related to a rating that could take us outside the jurisdiction of Northern Ireland could potentially be an issue of competence, and we'd need to be very careful about that, even if it wasn't the rating, an actual number related to a particular business. Anything that would be required in law to be done, we need to be very careful that there is the competence within the Assembly to be able to do that.
I think we would still want to work with any of the providers and the businesses directly that have an online presence and sell food online, to encourage them to put the link on, and we can take that up and do more. We haven't done a huge amount, it has to be said. We've worked with some third-party providers such as Just Eat. There's really a lot more work I think we can do there. And in providing the know-how to the businesses, even to apply the link and for it to work. Once you've put it as a requirement on the bill to draft it and for it to be meaningful, I think you do though have to have some of the answers to the questions we've raised about where it would be, and that's really, really important then for the enforcement as well, because if you had a very general requirement, it's very difficult to enforce. So there's quite a lot of effort that would go into seeing that it happens. I think we can do an awful lot more around our promotion to say to people, I think once this, if the scheme's mandatory, I think the profile of it will be much higher and people will know that they now need to see it on a door. So I think we can do an awful lot more then in our promotion to say, what about when you're online? And really, really making people aware of our website. You just open another window on your computer, you put the name of the business in, and you get it. So it's not that it isn't there, it's just not as accessible as it could be. But I think we can certainly do more than we're doing at the moment to try and make that more accessible and encourage the businesses to do it. And you're certainly seeing with third-party providers. I mean, there's apps and things appearing on the market where this can be quite easily accessed, through phones and things. So those third-party people are picking it up and using it in inventive ways we don't probably even know how they're going to do it yet.
The great benefit of that approach is that whenever the marketplace and tech companies are driving that themselves, they do that at their cost and to drive their business model. There's no cost to government. There's no cost to district councils to enforce something which would be very difficult to enforce. So the market, in effect, occupies this space, and in terms of how IT and the internet has evolved in recent years, I mean, it's quite clear that will continue to be the case. Websites, we talked about official websites. I mean, outside of the likes of your major supermarkets, who clearly have a very well-defined business model that can operate on that basis, a lot of businesses, particularly smaller ones, they're not actually going for the website route. A lot of places, as Catherine said, are using Facebook and so on. So to try and put something very prescriptive as to how a rating should be displayed on the internet would be extremely difficult to do. And ultimately, we still know that only a small proportion of consumers use web ratings. The most popular, and what will become even more prevalent, will be using the rating at the point of purchase at establishments.
I know there are many complications, but I don't think it needs to be as complicated as being made. I think it could be as simple as just as when you turn up to an actual restaurant or food outlet and where you would go to order food or receive food, that you would see the rating surely when it comes to online, it could be as simple as wherever on that page, whatever page you're able to access the food as an order it or place an order, that's where you should have access to the rating. Either whether it's the rating itself or a link to the rating. I just think it's kind of too important not to be left out. It's too large
some other way around.
sector.
Okay, I mean, I'm sensing you're not convinced, but I mean, obviously we'll be reflecting just on what we've heard today. I mean, I'm certainly getting the sense that there's more that FSA can be doing on the issue anyway. But we'll reflect, I think, going forward, Pam, on what we've heard today. Okay, clause 12, sorry, 12.2. The councils had expressed concern around the requirement for them to provide certain information to food businesses in the 14 days after they register. The councils had made the point that they provide a lot of information prior to registration and that they wanted some flexibility in terms of being able to provide information at various stages of the process. You have accepted this concern and are proposing an amendment, and again it's just to get a sense from yourselves of that amendment, the
yes,
detail.
That's exactly the case. On reflection, when we look at what was drafted in the bill, we hadn't in fact taken into consideration how this information would be provided to new businesses, and the councils are perfectly correct that they will be working with the business for a long period of time, quite often before the business actually registers. So Amendment 22 provides additional words to Clause 12.2 to ensure that councils can continue to provide the information before the 14-day period following registration if they wish to do so. It's a pragmatic approach and it reflects what current practice would be, so they can continue to do that. Similar to what we talked about earlier about providing the information following the inspection. Sometimes it happens at time of inspection, but in any event it has to happen 14 days. So we've given that there's the outside point in time in which the information must be provided, but it can happen sooner.
Okay, and it's clear enough. Members clear on that or need any more information? Clause 14, and we've touched on some of this as well, the related amendments to Clause 4 and Clause 18, and the introduction of the new clause and the adjustment of time periods, which we touched on at the start of this process. The committee had just expressed concern around the wide-ranging powers contained in Clause 14, 14.8, and that these are shared by the examiner of statutory rules, who believed that it was an inappropriate delegation and set a dangerous precedent, was the term was used. The FSA has now accepted that the examiner's points, and again proposing that range of amendments as set out in the letters to the committee dated the 5th and 26th of February 2015. Maybe just some detail on the amendments. I think it would be useful to have clarification on whether the power to substitute different time periods under subsection 1 of the new clause can be done at any time, or only again, and this has come up a couple of times in the course of our discussion today, only after review of the Act, and maybe that has previously been dealt with, but just to clarify that.
Yeah. Because these amendments are very technical, it's quite difficult to explain it, but I mean, I think what I would like to point out that we have fully taken on board the points that were made by the statutory examiner in relation to 14.8, and in essence what we now have is 5 powers in prescribed situations where we would have the ability to amend through regulations. Those are very tightly defined within the bill, and they would all be subject to affirmative procedure in relation to these powers. So that sort of wide-ranging ability to change primary legislation has been completely removed. In the event that we wanted to bring forward amendments to the Act that are not covered by these provisions that are now listed, then we clearly would have to do so through seeking amendments to the Act through the Assembly. So this area has been completely addressed to be very clear as to the 5 powers whenever we can amend through the regulations. We've touched on the issue of review, and in the case of these provisions where we can, what we're proposing we would be able to change through the regulations. Again, in the first instance, they would be linked to the review that would be carried out, but thereafter they would not always be linked to review because of other ways that the evidence may come to light that we need to change those particular provisions.
Okay, but not always linked to the review?
No.
Okay. Members have any clarification, comments on that? Okay, folks, thank you very much. Certainly useful, and obviously we'll be reflecting on the evidence here today. Thank you for your time and detail. Okay, members, just to advising you all that we will obviously now, going forward, wish to consider the information we've heard today. I'm seeking agreement, members, that we discuss this evidence in closed session at our next meeting next week. Okay, thank you for your time and attention on that. Item 18 is self-referral for physiotherapy, the Chartered Society of Physiotherapy. Just referring members to a briefing paper from the organisation at page 3 of your tabled papers. There's also a paper from the organisation that addresses the Minister's decision to stand down the project board for physiotherapy self-referral, which is at page 7 in the tabled items. Waiting until our visitors arrive. Hey folks, you're very welcome. Apologies for keeping you so long. That was a long first session. Very welcome to the meeting. Natalie Besweatherwick, did I pronounce that correct?
Almost 100%.
Almost 100%. What is the correct pronunciation?
It's just as it sounds, Besweatherwick.
Okay, thank you very much.
Cornish.
Director of Practice and Development at the Chartered Society of Physiotherapy, and Tom Sullivan, Public Affairs and Policy Manager. You're both very welcome. Just going to invite you to make some opening comments, and then we'll open it up to members' questions or comments.
That's good. Thank you very much, Chair. I'd just like to thank yourself and the committee for inviting us here today to provide some insight into the issue of self-referral to physiotherapy in Northern Ireland. The CSP is a professional, educational and trade union body which represents 53,000 members across the UK, believes that the introduction of self-referral has the potential to address some of the challenges currently being faced by the health service in Northern Ireland. It is clear that the demand on our health and social care system is increasing, not least because of the increasing number of frail and older people with chronic conditions who require more attention. Our members are working incredibly hard in very difficult circumstances to deal and meet the needs of vulnerable people. We believe that the introduction of self-referral, as has happened in other parts of the UK, can go some way to addressing some of the pressures on the system. Self-referral aligns itself perfectly with the aims and objectives in Transforming Your Care, which is essentially about patients being able to access the right services at the right time in the right location. Indeed, when Pamela McCready, the Director of Transforming Your Care, announced the self-referral pilot last March, she said, "Self-referral physiotherapy is very much in line with the strategic direction of TYC, offering patients and clients greater choice and access to services, earlier intervention and enhanced self-care and self-management." It is disappointing, therefore, that despite explicit provision within the commissioning plan for last year in this, we find ourselves in a position where we still do not have a pilot for self-referral going forward. I'm going to end on that note, Chair, because I think it's probably best if I hand over to Natalie, my colleague, as the Director of Practice and Development for the CSP. Natalie has over 30 years of clinical and management experience in physiotherapy, and indeed was responsible for introducing self-referral to Gloucester Foundation Trust. So it's probably best if Natalie gives you some of her personal testimony of how that operated and how it was introduced there, and then we can have some questions and answers from that. Natalie.
Yeah, Natalie, yeah.
Thank you very much. Thank you very much for your kind invitation, and it's very pleased to be at Stormont again, and pleased to recognise Paula Bradley, who has a CSP event a couple of years ago, which I attended. So it's great to be here again. I want to go through my personal experience as a lead of physiotherapy services in Gloucestershire when we introduced self-referral for people with MSK conditions. The population of Gloucestershire is about 600,000, and the area comprises urban, semi-rural and some rural locations. By way of overview, the approach I took was an incremental one, and there was very strong GP involvement from the start in terms of the planning. The question I was going to answer first is, why did we do it? We knew from the evidence base, even at that time, that people who had early intervention from physiotherapy for people with a bad back, a bad neck, a pulled muscle or whatever, that they were able to return to their normal activities and return to work in a much more expedient way. They also required less resources. How do we sell it to the GPs? I went out with my colleagues to visit all the GP practices that we were going to work with, and we shared with them the evidence base about what physiotherapy could do and the demonstrable effect of early intervention. We also said to them, this will save you time and this will save you administrative time, because if patients can refer direct rather than having to see you, it means that you can take those slots up for those complex, maybe more elderly or complex patients that need to see the GP. What we did after we met with all the GPs, they were pleased to be involved in a pilot. We started very small. We started with 3 GP practices in one location in Cheltenham, in Gloucestershire. And we'd taken baseline data before. We looked at it at 3 months and in 6 months, and when we were sure that we were seeing the effects we expected to see, we then grew in terms of opening it up to further GP practices. It took us over 2 years to cover the whole population of Gloucestershire, but my experience is that incremental approach is really useful. It allows you time to, if you need to tweak something, with the best planning in the world, if you need to tweak something, you get that time to do it. If things unexpectedly turn up, you can actually attend to them. What was the result? Our waiting times, they've been around about 6 to 8 weeks, in some areas higher. They all came down. In some areas, they came down as low as 2 weeks, but the average was 4 to 6 weeks at maximum, and that's for what we call routine or non-urgent referrals. The other big changes to data were, it's a funny word called DNA rates. DNA is the people who don't show. The don't shows the people who did not turn up. And of course, for every one of those that you have is a waste of resource. Our rates of people not turning up had been about sort of 6 to 8%. They went down to 2%. We managed also, what was interesting, that over the period of time, and by the time we were looking at doing the evaluation at a year, we realised we were seeing more patients with the same number of staff. And that's because each patient was requiring less intervention than had been previously, and because we were maximising every clinic slot, for want of a better word, because we had far less people not turning up. As part of the evaluation, we also undertook a GP satisfaction and patient surveys post-treatment. their responses were incredibly positive. The GPs loved the fact that they had less administration to do by referring people on. They were much appreciative of patients being seen by the right person at the right time. And they also reported back to us that their patients, if they'd come back for something else, said what a great experience they'd had. The patients, the majority felt more in control of their symptoms, and they felt they were able to manage their condition much more effectively because they had been advised on some self-management. The type of quotes we had are very similar to one that I'm taking now from a recent news piece from a general practitioner in Plymouth in the southwest of England. And this person works for one of the commissioning groups. This is the Northern, Eastern and Western Devon commissioning group. And he said on this news piece in the last few weeks, being able to self-refer makes patients feel empowered because they have the chance to say what symptoms they are experiencing and how it is affecting them. Allowing patients to self-refer also reduces the overall MSK workload for GP practices, which frees up appointment slots in very busy clinics. There's only one concern that people always raise when they are considering self-referral, and that's one that, will it not just increase demand? This did not happen. It's always been the one that people say, you know, if you have self-referral, will it open the floodgates? My experience is if you do incremental change and you do it bit by bit, you do not see that increase in demand. And if you do see any change, it would be because you'd had your baseline resources hadn't been adequate in the first place. My conclusion is that looking at my colleagues and physiotherapists who work in Northern Ireland, they've done a massive amount on the musculoskeletal pathway anyway, and they have worked hard to improve the access for what is your constituents to their services. Physiotherapists now can independently prescribe, and in Northern Ireland at least 9 physios that can independently prescribe, and there are physiotherapists in each trust that can inject if required. So the services across Northern Ireland are more than ready, I believe, to be able to pilot self-referral now. The other thing that I think is really important for you as the Health Committee, self-referral does empower people to help manage their own conditions. And I think that's absolutely in line with the Donaldson review that I've read recently that's reported for Northern Ireland. So from all that, in my own personal experience, I really do truly believe self-referral is a no-brainer. And I'm happy to take any questions. Thank you very much.
Thank you, Natalie. Very useful. I mean, I'm noting that you're saying incremental change around these issues.
Yes, I am.
Is appropriate. And he's indicated that waiting times...
They do come down.
Had come down.
They do.
In your experience of those programmes that you've outlined,
yes,
was there a cost analysis done in terms of... I know this isn't about the savings as such, but cost analysis in terms of keeping people off those lists, keeping people out of emergency departments, that kind of appraisal?
It certainly wouldn't affect probably people turning up to an emergency department, because the nature of most people's musculoskeletal conditions are such, of acute back pain, or, you know, a pulled shoulder, a bad knee after twisting too much playing golf, or whatever it is. They're not the type of conditions that normally would take somebody to the emergency department. But yes, the research has been done around self-referral in Scotland, in England, in the Netherlands, in the USA, all demonstrate savings. In England, the self-referral model has been fully examined by the QUIP programme, which is part of NHS Evidence. It's been found to be extremely cost-effective. The research has shown that there are savings to be made in decreased GP appointments, decreased use of diagnostics, and decreased use of prescriptions. In addition to that, not maybe for health, but certainly for working pensions departments, people that self-refer are much less likely to go off work or return to work faster. So there's a gain for the society in terms of people being at work. I've also evaluated self-referral for the hospital that I worked in, so for staff to self-refer to physiotherapy, and that had a substantial reduction in days lost from work. And for each day lost, we actually costed that up. So a massive saving in terms of decreased locum use within a hospital environment, for example, and that was significant. So there is strong evidence in support that this is a cost-effective way forward.
I mean, I think also in relation to our own situation here, it's also a clear policy fit.
Yes.
In relation to, you know, prevention and moving the focus from acute, but specifically interested in the pilot here and the impact of that, and then, you know, your view on why it was more a question for the department, but why the decision was taken or what rationale was provided to pull it.
Well, other than what we received from the Department of Health, that they decided to defer it on the basis of the pressures on waiting time targets at present. In my view, that's not a rational or logical reason for not proceeding. The reason that we decided to go with a self-referral pilot in the first instance was to offer a means by which you could gather and analyse the information that would be required before there was a further rollout across Northern Ireland. So in my view, personally, it doesn't make any logical sense not to proceed with the pilot. That was the whole point of the pilot in the first instance. To gather that information, analyse it, and then look at what potential obstacles or barriers there might be to rolling it out and how do we overcome that. I think it's important that, as Natalie had said when she introduced it in Gloucestershire, that we take an incremental approach. It wasn't about a revolution overnight. It was about incrementally doing this by degrees, looking at the demographics in each locality as well, and seeing how that would apply differently in those localities. So it's from our point of view, it doesn't make sense not to go with the pilot.
And has there been any further follow-up from the department on that, given that these sound systems are awful today, given that we're going to be discussing this with them in the next session?
No, other than I would understand some of their concerns that there would be a perception that there will be a huge spike in demand, and that some waiting times for outpatient appointments in some areas are quite challenging at the moment. So maybe there is a certain degree of caution about introducing self-referral and there being a huge spike in numbers and that being reflected badly within Northern Ireland, but also perhaps some concern that if we introduce self-referral across Northern Ireland, we need to demonstrate that it works in order to make the argument for rolling it out across all of the other trusts.
Okay. And apologies about the noise, it's just busy MLAs and their phones going. But just reminding MLAs to just double check, please, their Blackberries. A number of members wanted to indicate it to speak. Kieran first.
Yeah, Chair, thanks very much. Thanks very much for your presentation. And you mentioned the word no-brainer. I mean, I was going to, when you were doing your presentation, I was thinking common sense. Would you agree with me that there seems to be a lack of common sense in the people, whoever is making the decision? Because I can remember it was the former minister was here and he was enthusiastic about the introduction, and whether the chair was here at the time, the introduction of this self-referral, and suddenly it's not happening. And I'm looking at this, the report here. England 46%, Scotland 50%, Wales 62%, Northern Ireland nil. Surely somebody must be hugely embarrassed whenever they look at that and see that we're once again lagging behind. And as Tom, you said, it was initially for a pilot operation, and we haven't even started it. Where do we go from here?
Well, I think, Kieran, some of the issues that have come to the fore recently in terms of the Donaldson Review and some of the recommendations, I think, reflect the lack of movement that there has been within transforming your care. And obviously the recommendation that there should be renewed impetus and a timetabled programme for moving forward on transforming your care. I think that somewhere along the way that has lost its impetus. For whatever reason, I'm not sure exactly why, but somewhere along the way, self-referral perhaps got lost within that. I also think perhaps it reflects overall where physiotherapists and other allied health professionals sit within the structures, and sometimes our voice wouldn't be as strong as perhaps some of the other professions, and therefore when those conversations are being had at that higher strategic level, perhaps at times we're not included, and therefore perhaps either by default or perhaps by design that our issues are not as prominent as they should be.
Yeah. But again, once we're on a journey on this transforming your care, and here is a perfect example of where those in authority are falling down, you know, on their own programme, you know, and the Minister certainly was very excited about this. Is there someone somewhere other than the Minister pulling the strings against what we're all trying to do?
I don't know about that, Ken. What I would say is that obviously that was highlighted in the Donaldson Review in terms of who's in charge. What I would say is I don't think it's down to individuals per se. I think it's down to systemic reasons for that. I wouldn't want to say that it's down to any individual or any one person, that the system is conditioned to react and behave in the way that it does. I think you need to change how the system currently operates in terms of policy. There is a tendency, as Donaldson noted, for the system to operate according to departmental silos without any consideration of the wider strategic intent. And that perhaps what we need to do is to change the system in terms of being better to incorporate or integrate the views of all of the professions in terms of coming up with solutions.
Okay,
and I think as well, Kieran, there'll be a line of questioning to the department who are next around the rationale for their decisions. And again, I'm going to apologise for this interference. I don't know what's causing it. Joanne's next.
Thank you, Chair. Can I thank you for your briefing? I suppose maybe an observation to start with. We all know how much pressure GPs are under, and I know me personally, and I'm sure other members are the same. Increasingly, constituents are coming saying how difficult it is to get an appointment with their GP, and then added pressures that has if they feel they have to go to ED, and the 20% shortage of GPs at the moment. So I think your conclusion, your final comment, Natalie, was very apt. Self-referral is a no-brainer. So I agree with Kieran on that. And given that, as we know, I think 25% of GP visits would be muscular related, surely it is a no-brainer. A system of self-referral would obviously relieve that pressure, because reading through some of the details, and this is nothing new. I think it was back in 2008, if I'm right, the argument one day when Alan Johnson endorsed National Rollout Service of self-referral to therapy sessions. So why has it taken so long for Northern Ireland to catch up? Can you understand the rationale behind that? It certainly does seem a no-brainer given the pressures GPs are under.
I'm certainly just want to reassert that the evidence base is very strong and has got stronger over the years with other countries, and notably for the USA, which is an insurance-based system, has actually demonstrated the cost-effectiveness of self-referral. I mean, I think initially some of the UK research wasn't considered maybe is strong enough, and there wasn't consistency from countries that perhaps had tried it outside of the UK. But now that we have very strong evidence also reinforces that, I think that adds to the weight of the evidence we've had from Scotland, England, which has been helped by the evidence also from the USA and Netherlands on that regard. I think some people feel that worried sometimes with musculoskeletal conditions about can physiotherapists manage that. It is their bread and butter in terms of practice in this particular area. They are well versed in obviously assessment, diagnosis. They understand what is called red flags. Those are the types of conditions that are warning signals for something quite serious. They are all trained to look at those, and it's when you're bringing a new system in self-referral is really just a new referral system. It's important that we get all that planning right from the beginning, and that can take time. And it's my understanding actually that planning has been significant and fully supported right across Northern Ireland, with maximum involvement of physiotherapists and others to ensure that any risk is fully mitigated against. So I think all the evidence now is saying the time is right, the time is now.
Yeah, and Tom touched on this, and waiting times are deeply worrying for patients, and I note the Minister calls it a challenge. I can only imagine what patients might call it. Surely there's so much greater costs and pressures on our health service if patients go without the physio, the muscle weakening and they cannot regain the strength. So we should be, I feel, pressing ahead rather than stopping the project. And Kieran touched on this earlier. I wasn't in the previous health committee private mandate, but I understand the current minister's predecessor planned to roll out the service across Northern Ireland by, I think it was March 2015. It was envisaged that would happen, and we know that this hasn't been achieved. When would be your best guess then as to when this could be brought in by?
I think what we need to do is have the pilot first,
of course,
and take that forward. And again, that any prediction of how we would roll it out across Northern Ireland would be based on that analysis, and that's why, again, it doesn't make sense not to have the pilot.
The absence of a pilot, then it's pushing it further away.
Of course it is, yeah. So it's impossible for me to say, Joanne, precisely when it could be done. I would like to see it done tomorrow in an ideal world. However, we are realistic and practical and recognise that there are other pressures on the service, that we're going to have to do it incrementally, but the pilot was the way to do that we need to move forward, first instance, on the pilot, get it out of the way, use the analysis and move forward from that point.
Hopefully sooner, as you said.
Sooner rather than later.
Yeah. Okay, thanks. Thanks, Chair.
Okay, members, I'm going to adjourn for a minute to try to work out what's going on with this system, so adjourning the meeting now just for a minute. Can members, witnesses, public gallery check?
Interfere the same.
Mine's only Wi-Fi.
I've set everything back over here now.
43G one. Well, mine's Wi-Fi too, but it's
Back
just...
them over my shoulder.
Mine off. Put mine off.
For my technology
Anyway,
expands.
Worked individually and eliminated.
They go who done it. Okay, thank you for that. We'll open up the meeting again. Next, I have Fergal.
Oh, thanks very much. No, I'm impressed by the process outlined and your presentation. Obviously, it's money saving, etc., etc., etc. So, given that it is such a no-brainer, then what are the blockages in the pipe? Maybe it's unfair for you, given that the departments come in afterwards. But are there any medical blockages? For example, while something might present itself as musculoskeletal, it could be hiding a cancer. And are there any GP worries, medical worries there that they want to step through those process of analysis first before it gets to the... So I just want to know, given that it's such an obvious answer, that presenting with savings consistent with TYC, shorten waiting queues, etc., 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 Why is it not happening? And are there any other reasons out there that we're being blindsided by, which could lead to this not being adopted swiftly as it is in other areas?
To my knowledge, Chair, there is no medical reason why this should not be pursued. The planning and the processes that I understand that steering group and the people involved have undertaken would be ensuring that the referral mechanisms, the assessment processes would fully cover and have a full pathway through which you could determine a diagnosis, and you would actually identify any of these, as I said, these red flags. This would indicate perhaps a cancer or something serious going on. And physiotherapists do that as part of their standard assessment. So there is, to my knowledge, there isn't any indication for that to be a blockage.
Could there be any financial arguments so that the department is looking at?
There could be some issues, Fergal, around capacity and demand at the moment, as I've already mentioned, in terms of workforce and being able to meet the perception of that initial spike that you might get, or stampede for people to self-refer. But again, that hasn't been the experience, and that's more of a perception than a reality. I do think there are issues around workforce. I think the physio workforce, like other professions, has been affected in recent years by vacancy freezes and recruitment difficulties, given the financial constraints. And that has to be a consideration, perhaps, in maybe the reticence to move forward on that. But again, I would say it's a pilot. All of those factors would be taken into account, and there is no impediment from the other professions, as far as I'm aware, to doing that. I think the GPs would actually welcome some of the pressure being taken off them in regard to that. There isn't a day goes by, as we know, in Northern Ireland, where we don't hear that GPs are at capacity themselves in terms of meeting the demand, particularly for frail and older people, and also the increase in the number of chronic conditions in particular. And again, the system overall is under pressure, as we know, but there is a potential, we believe, if you combine self-referral and newly acquired independent prescribing rights for physiotherapists, then that could be a real source of benefit to general practitioners as well. But to answer your question, no, I'm not aware of any impediment ideologically to self-referral for physiotherapy going forward.
To what extent do people go privately to physiotherapists, and is that something that the department would want to drive people towards?
Well, I think those who can afford to go immediately. Those who can't afford.
I'm not advocating that as an approach. You know what the SDLP's approach in relation to these things as policies are.
Well, I mean, as an organisation, we are obviously fundamentally committed to the health services. You know, free at the point of entry, funded out of general taxation, and accessible to all on the basis of need.
Yeah.
I don't know what your experience was in Gloucester of people going privately, Natalie.
My experience would be, as you've said, Tom, that patients that could afford and chose to see a private practitioner did so, and it didn't make any difference to that population that took that choice anyway. I think self-referral is there to improve access for people who could not afford to see a private practitioner, but what you want to do for your constituents is actually improve access in a much more timely fashion, which will have those subsequent added benefits further down the line about getting back to work, getting back to normal activities, using less medications, etc., etc. So it still all stacks up, but I can't add anything more, but it didn't make any difference to the private practitioners in the area at all. It didn't reduce their work.
Just the final point, strangely, a pilot could prove per head more expensive because it's smaller, and if you take in the scale of demand, and is that something that could impact?
I think there could be more discussion around how we take the pilot forward. I think there's room for negotiation and discussion around how the pilot proceeds. Yeah, but again, that shouldn't take months.
No.
You know, everything was ready to go in April 2014, and we would be in the same state of readiness. Maybe we need to look at whether you do it across the whole trust or you do it with a number of practices and build it up from there.
I said finally, but finally. And is there any breakdown in communication? Is there what's the state of play in terms of how you guys are communicating with each other around this?
No, there's always been a good relationship in terms of the communication that we would have with Michelle and her colleagues at the Public Health Agency in relation to the project board that was put together. Was a combination of our physio lead in the south and east, the GP involvement, actually user involvement from Arthritis Care representative, and also involvement from the Public Health Agency as well.
Okay, thank you, Chair. Thanks.
Okay, thank you, Fergal. Paula's next.
Thank you, Chair, and thank you, Natalie and Tom. Most of the questions have been asked, so I'll not bore everybody by asking the same ones over again. So just want to make a couple of comments. You both are aware of my support that I have had for this from the very first I heard about it. You both know I worked as part of a multidisciplinary team with some of the most professional people I ever worked with were our physiotherapists. And I think a lot of people get hung up on what they say as a physiotherapist. And that's how I used to visualise a physiotherapist until I worked as part of that team and saw the intricate work that they did in managing long-term conditions and long-term diseases that, you know, take precedence on a hospital site, to the likes of COPD and various different long-term conditions that they deal with and that they're working with every day. And then we have the self-referral for other conditions and other needs. And I mean, to me, again, this is just, I can't believe actually we're even discussing this. I can't believe this wasn't done a long time ago, because we all know self-referral is nothing new in the health service. This has been going on from time immemorial. You know, we have the likes of speech and language therapy that has always had self-referral, with the likes of social work, which has self-referral. So why are we sitting at this stage, you know, thinking, why did it ever come into being that this wasn't the best idea and a great idea to alleviate pressures on our health service and to capture an audience that weren't being captured in other areas of the health service, and getting them involved in early intervention and prevention, and, you know, long term, that's far better for our economy, it's better for our society. So, you know, when I sit and read this and read the letter that we received back, and I think, this is nothing new. Self-referral is nothing new. Why are we even having to debate this?
I don't have all the answers to that, Paula, but I agree with you entirely that it should be, it's an obvious solution in many ways to a lot of the challenges here. I think Northern Ireland has in the past been playing catch up with a lot of these innovations that have happened elsewhere, and again there are probably reasons, historical and structural reasons for that. But again, I can't give you a definitive answer as to why it hasn't proceeded at this point, other than I do think that with the Donaldson review, with the commissioning plan that was produced recently, with the I think the involvement of AHPs that is outlined in the commissioning plan, that there is perhaps a renewed impetus to move forward and better utilise the skills of physiotherapists and others. And I think you're absolutely right that there is a lack of understanding amongst the wider public and others, even amongst other health professionals, about the range of input that physiotherapists can have, whether it's in neurology, whether it's in paediatrics, whether it's in COPD, etc. And I think, again,
even to do with feeding regimes, you know, things that people would never think of that a physiotherapist is involved with, and freeing up services in order that the physio can carry on with those professional jobs that they have. If we had this other end dealt with through self-referral.
Absolutely, Paula, and I think it comes back to what I said earlier, that perhaps maybe in the past, and maybe at times currently, that we haven't been involved in those conversations at a strategic level in the way that we should have been.
Okay, Paula, thank you. Thank you both. I assume you've heard the support across all of the members today, and the fact that this scheme is a policy fit with transforming your care. Should not be rocket science, and certainly the energy and appetite in this room to make it happen. So I hope you will have the time to listen into the next session in terms of how those decisions were reached, and we'll continue to have the conversation. Thank you, Chair,
and thank your committee as well for their time.
Thank you.
Okay,
thank you
thanks.
both.
Cheers.
Okay, members, moving on to the next evidence session is on the same issue, self-referral for physiotherapy in the Health and Social Care Board briefing. Just referring members to the letter from the Minister considered at our meeting pack on the 14th of January 2015 regarding the self-referral at page 37 of your packs. Just advising members that the Board were asked to provide a paper in advance of today's meeting, and they haven't done so, and haven't provided any explanation to date.
Chair, has there been any correspondence with the Trust, the South Eastern Trust? They were supposed to be involved in this from April 2014.
The Board commissioned it, so the Board would have to address that.
All right, okay.
Okay, you're very welcome, Dean and Michelle, both very welcome to the meeting. Maybe the first question is to ask why we didn't have a briefing in advance of the meeting.
Sorry, Chair, I wasn't aware you were looking for a briefing. I was told that I'd had the opportunity to give you a briefing as at the initial part of the session, but certainly happy to forward something in writing to you afterwards.
Well, sorry, the invitation, which was some time ago, I'd asked for a briefing.
I'm certainly happy to forward that on.
So can I just express disappointment, because obviously we want to be in a position to reflect properly on the issues at hand, so I hope that you listen to that and we're not in a similar situation again.
Okay, Chair.
Okay, can I maybe invite yourselves to make some opening remarks?
Okay, Chair, I'll keep this brief, being conscious of the time of the day that it is for members. I'm Dean Sullivan, Director of Commissioning at the Health and Social Care Board. My colleague beside me is Michelle Tennyson, Assistant Director for Allied Health Professional Services, and would be our professional lead in this area. As you will have heard from colleagues before us, direct access to physiotherapy allows patients to refer themselves directly to a physiotherapist without first having to see another healthcare practitioner, typically a GP. There is evidence from elsewhere that allowing self-referral for physio can have a range of benefits: improve patient satisfaction, improve patient empowerment to self-manage, improve patient compliance with treatment regimes, better patient outcomes, reduced do not attend rates, and the opportunity to free up GP time. However, at the same time, there's also evidence that self-referral can result in an increase in the number of referrals, potentially by as much as 20%, although this can often settle down into a more stable pattern after initial increase in demand. Against the above background, the Board's commissioning plan for 2014-15 proposed the establishment of a pilot to test self-referral to physio within one LCG Trust area to inform decisions on whether and how there should be wider rollout across Northern Ireland. To take this work forward, a project team was established. The 5 trusts within Northern Ireland, their readiness to implement direct access for physio was tested, and South Eastern Trust was identified through that process as a preferred provider in the context of a range of criteria, one of which was the current waiting times for physio services. Detailed planning discussions with South Eastern Trust followed on from that initial identification as a preferred provider, and there was then the development of a final draft business case, which was forwarded to me in recent days and weeks. Final draft business case proposes a 4 to 6 month pilot, which would allow time for initial settlement evaluation. It would have the capacity to handle referrals up to between 20 and 23,500 per annum, which would be between 10 and 20% more than is the case now. It would increase staffing within the physio team within South Eastern Trust by 3.4 physiotherapists, and would have a cost for that period of just over £60,000. Michelle and I, and indeed even chatting to colleagues, Tom, earlier on this afternoon, are taking forward further refinement of that model to make sure that we test the opportunity to realise all of the benefits from this. But we're, certainly from my perspective as Director in charge of commissioning, substantially there on this. It is about making sure that we fully explore all the angles on the model, drawing on experience elsewhere. So the next steps, finally, Chair, from our perspective, are to finalise that agreement with SET, which will look like what I've described, and then to, having run the pilot, make a decision on the longer-term rollout, both within SET for physio, at other trusts within Northern Ireland for physio. And indeed, as I look at the potential benefits of this within a physio setting, it may well be that there's similar opportunities within other AHP professions as well that we would seek to explore too.
Okay, thank you. Then just so I'm clear, I mean, you're saying now that you're going ahead with it, cutting through.
I'm saying now, Chair, that it had always been our intention to take this work forward as set out within the commissioning plan.
But there was a decision somewhere to defer.
There was a decision that, pending greater clarity around the waiting time position, what I couldn't do is to introduce this at the same time as we had particularly long waiting times within individual trusts. So in the context of the work that was taken forward by Michelle and colleagues to tease out with individual provider organisations what their waiting times looked like, to ensure that waiting times were as short as possible, and in parallel with other capacity planning work that Michelle, working with my staff, was taking forward. What we couldn't do was to bring this in to an unmanaged waiting time situation.
But I'm sorry, Dean, and I do have to interrupt, right? And just in layperson's terms, we are now about to introduce the scheme. Is that what we're saying?
It would be my expectation, Chair, that within the next 2 to 3 months we will initiate the pilot. What I'm saying is,
okay.
What I'm saying is there's just elements of that to be refined, working with Michelle and working with colleagues within South Eastern Trust.
Okay, and yes. what I'm not clear on, and I do want to tease this out a bit, there was a decision to defer. Just explain that.
Well,
and who took that decision?
Well, I wouldn't describe it as a decision to defer per se. There was a decision not to start the scheme until there was sufficient clarity around the issues that I described, Chair. You may say it's the same thing.
Well, there's different correspondence going back and forward, I know, to myself as well as different organisations, but you know, I'm not going to get into a whole discussion around formula words, defer, stop. There was a decision somewhere that the scheme that had been identified that was ready to go did not proceed.
Well, perhaps, you know, if I can help in that regard, I have, as I said, literally in the last number of days received the final business case from South Eastern Trust for the £62,000 that I've talked about within the last number of days. So both in the context of finalising that business case and in the context of ensuring that we don't seek to introduce self-referral into a system where we couldn't see the impact of self-referral, we get to the place which is the one I'm describing now, which is we're just about there. In a couple of months' time or so, we'll be ready to go with this.
I mean, I have to say I do take issue, Dean, with the sense that within the last couple of days you've received all of the information, you know, in terms of the previous Health Minister, Assembly questions, correspondence, this was up and ready to go as a pilot. And I think all of us were very clear that you couldn't go in over all of the trusts and influence or impact on this particular issue, but you could pilot it, and that information would be used then to analyse how to go forward. So, I mean, I find it...
Fully agree, Chair. All I can say to you is, in the last number of days, I have received the final business case from the Trust. There was a previous business case that had been prepared by the Trust, which was for a different amount of money. That was in further discussion between Michelle, myself and the lead within South Eastern Trust, revised as a staffing model was proposed by the Trust was changed. I'm saying there may be some further revisions, but those are the facts of
so just to be clear again, what changed in the two business cases?
I think within the first business case there was the inclusion of 3 Band 7 staff and 3 Band 6 staff and a Band 3 administrator for a period of 4 months. Within the second business case, there were the costs associated with the upgrading of 3 Band 6 staff to 3 Band 7 staff, and then the backfilling of the 3 Band 6 staff plus the Band 3 person, which brought the cost down from about 93,000 for the 4-month period to 62,000.
Chair, maybe if I could add, the project board was established for the pilot in September 13. We had a range of stakeholders working with us for a period of time. In December 14 was when we actually finished the preparatory work in terms of working out the figures, liaising with our GPs, designing our referral forms, etc. So it was that preparatory work that was completed in December.
But I do want to labour this a bit, because there is confusion. You know, when you've referred to it now, Michelle, in terms of the project board, there seemed to be confusion whether the project board was stood down. I mean, the correspondence from the Public Health Agency was quite explicit that the project board had been stood down. In fact, and I quote, "Please accept my apologies, but I regret to have to advise you that I have temporarily stood down the project board structure for self-referral physiotherapy," and that was on the 1st of the 2nd, 2014.
That's right. That's when, as I say, in December we had completed the preparatory work for the project, and we were awaiting the outcome of the business case then that came through to the board. So in terms of being able to further prepare, we weren't able to do any more, so we stood down those meetings, awaiting the outcome of the funding decision.
Does it not indicate or highlight a bit of confusion between, or lack of communication between the board and the Public Health Agency?
I don't think so, Chair. I think perhaps on reflection the word "stood down" was unhelpful, because I can see how that would have been interpreted as in a way that you seem to have interpreted it.
Well, you see, I mean, I think the reality is, Dean, it didn't happen. You know, that's the reality. Whether it's stood down, postponed, it didn't happen.
I think the terminology has to be taken in the context of the discussions that we had with the steering group. So I can appreciate my colleague saying it can be interpreted in one way or the other, but that correspondence was to the members who we'd already had discussions with, to clarify that.
Okay, Fergal, I think it was on this, was it? Yeah, sorry, go ahead. Yeah.
Although I'd indicated to ask, so are you continuing or?
No, go ahead,
okay.
Go ahead, yeah.
So given the history of this project and whatever the language, you might forgive me now for looking for some clarity about how we go forward and language. So you just talked a moment ago about 3 or 4 months or so. So I wouldn't be betting the farm.
2 or 3 months.
2 or 3 months or so.
To be clear about what the pilot actually looks like.
I need to know now with clarity, because you also referred to issues that might have to be addressed. So with clarity, what is the timescale for it starting? And what are the issues that could affect that timescale, if it could affect that timescale?
As it stands at the minute, on the basis of the business case that has been shared with me, the intention is that the pilot would start in May 2015 and would run for a 6-month period from May 2015, with the evaluation running in parallel in the last sort of 4, 5, 6 months of that. On the basis of further discussion that I've had with Michelle and Tom, Michelle before today and Tom today, given that the pilot, the intention is to allow patients to self-refer into the service, but to self-refer into the service onto the same waiting list as other patients within the service. So if I was a routine patient and the maximum waiting time for routine patients was, say, 9 weeks, I would still be waiting 9 weeks regardless of whether I had self-referred or whether I had been referred by a GP. A lot of the benefits that I know Tom was sharing with you earlier on this afternoon, and that I'm fully bought into, in terms of if a patient is referred in to a physio and seen, say, within a week, does that actually allow a patient to get back on their feet much more quickly, to not need perhaps 5 or 6 sessions of physio, but perhaps only need 1 or 2 sessions of physio? Does that make it much more likely that if I was the patient, does that make it much more likely that I will turn up for my appointment and so on? I think a lot of those benefits we will only get through the pilot if actually we would need to do this very carefully so as not to destabilise the system within South Eastern Trust. A lot of those benefits we will only get at if we actually make direct access a thing where if you're an urgent patient, you're potentially seen within a week or less, and if you're a non-urgent patient, you're potentially seen within 2 weeks or less. If it's just a different way of getting into a reasonably long waiting time anyway, I'm not sure we'll see the full benefits that Tom will have described here. So I'm really, Chair and members, not trying to be difficult in any way today. I'm simply trying to make sure, as I've said to colleagues, that we get the best impact from this, and it may be that we would be better utilising that 60 or so thousand that I talked about running for a slightly smaller area within South Eastern Trust, but within that smaller area making the service the type of service that I'm describing.
Yeah, no, I can understand the point that the pilot has got to be a holistic pilot. It can't be something that's different from what the service would be ultimately. Otherwise,
that's right. Otherwise you're testing a different thing. That's exactly right.
But not that notwithstanding, however you arrive at that, that's how you arrive at that. But is that going to affect the start time and the length of the pilot?
I would be hopeful that it won't. I think certainly not. Again, just so we're...
Language is very important.
I do understand that. I do understand that.
As I say, given the history here, even hopeful...
I do understand that.
...isn't doing it for me.
I think...
I'll be honest.
Hopeful. So I was using hopeful as in maybe in a different context again from the way you perhaps interpreted that. What I'm trying to say is, we will do this properly, right? If doing it properly meant starting it in June rather than starting in May, if doing it properly meant running it for 12 months for a smaller subset within South Eastern area, then we'll run it for 12 months. If doing it properly means that it becomes available to patients that I self-refer in and bang, within a matter of days if I'm urgent, I'm being seen. Within a matter of a couple of weeks, I'm being seen if I'm non-urgent. Then we'll do it that way. None of those things feel massively complicated to me.
But you see, Dean, we're talking really about two different issues here. There's the scheme, which I think everybody here accepts, and then there's the language and communication, which causes all sorts of friction, and maybe even undermines projects.
Yes.
And it's that bit, I think, that puts feathers up and irritants into the system.
Well, might it be helpful, Chair, if you set me and Michelle a deadline then of coming back to you with a definitive position on this no later than the end of this month?
Yep.
And that would cover off your concerns, and as I apologise again for that around the briefing issue.
But I think also, Dean, it would be useful to get a sense if this will be included in the commissioning plan.
It's certainly my expectation, Chair. It's in the 14-15 one now. It's certainly my expectation it's in the 15-16. I
know there is a sense of AHP and how we do that, and a refocus almost. But I think it would be useful
explicitly to have
that explicit.
No, I think one of the challenges, and you've had my face here a few times now, so we're familiar with each other, and you know where I am if you need to get me in, sort of thing. One of the you know what the financial situation looks like, but if we're not careful, we will turn that financial situation into a reason not to do anything different. We will just keep doing what we've always done. We'll get what we've always got. I think there is an opportunity in this area to do something different, as you were saying, Mr. McKinney, in a sensible, proportionate, piloted way. But let's not pilot something that bears no resemblance. You don't learn to drive a car by driving a motorbike, sort of thing.
Yeah, but that, once again, I'm just differentiating. That's okay, and we're agreed on that point.
Yeah.
But I just don't want that language then around defining that to further kick this on down.
It won't. I will come back to you with Michelle before the end of this month with absolute clarity around all of the things that you require clarity on: start time, finish time, area of coverage, cost, all the rest of it.
And if it's not the commissioning plan,
and I'll make sure it's in the commissioning plan as well.
Okay. Kieran had indicated.
Yeah. I mean, we've heard this before. The minister, for instance, the previous minister said way back in March 2014, and here we have a year lost, actually. And Michelle, you mentioned the project board. Well, it was stood down. Is that going to be resurrected again now that you have given us this commitment today?
I think it's an interesting question, Mr. McCarthy. We will need to have some process to further refine the model that is proposed, and clearly to do that quickly, given my commitment today to respond to you before the end of March. So whether that's the full steering group or part of that steering group, we'll need to have something to finalise that model. In any case, though, we'll need to have some sort of a steering group arrangement to oversee the pilot. Whether, again, that's the full steering group process or a subset of that, we'll need to see.
You must understand the extreme disappointment that we have lost a year on this. I mean, the Minister said what I've relayed to you, and also Pamela McCready said self-referral therapy is very much in line with the strategic direction transforming your care. We all know that, we all support that, but yet here we are, a year down the line, and we're still hopeful. That's the word you used, Dean, within the next 2 to 3 months to introduce this self-referral.
Well, the only qualification around my hopeful there, it's a month either way. So it's a month, whether it's May. We can start it earlier than May, but there's, as I know from, again, discussions with Michelle, there's a fair bit of preparatory work required in terms of raising awareness of this. Again, no point in doing this and no patient is aware of this service even existing. So there'll be a bit of preparatory work to be done there. Whether that can be done in 2 months to 10 weeks, whether it makes more sense to run it from June for 6 months or for longer, all of that I'll set out in the response to you at the end of this month.
Do you, as the Director, do you feel any way embarrassed that we have lost a year? I mean, whenever the Minister stands up in the Assembly and gives the Assembly a commitment that this will be rolled out by March 2015, which we're now here, and yet you're telling us that we're going to have to wait for another 2 or 3 months, and it will be rolled out in the next 6 months.
Embarrassment wouldn't be the emotion I feel.
Well, I mean,
it would be. What I would say though is, a lot of these things can appear fairly straightforward to establish. If it was fairly straightforward, we would have done it by now. I'd prefer to be associated with something that is done properly, that I can come back to you if I'm invited in 9 months, 12 months' time with Michelle to tell you how the pilot has gone, and we're not sitting having a discussion about an ill-thought-out, improperly scoped, poorly resourced pilot that didn't actually prove anything. So I'd rather do the thing properly than rush the thing. Are you saying
that that's what we were talking about this time last year, an ill-thought-out programme?
No, I'm not saying that at all. I'm saying that these things take time to prepare for properly. There's a need to engage with a lot of stakeholders, both within the physio profession, but also other stakeholders, GPs and others, to make sure that as far as possible we have buy-in to these things. And there was a need, as I referred to in my introductory remarks, for a process to identify the trust that would be most appropriate to lead on this, which was also done in the last year.
Which is the South Eastern Trust.
That's right.
Yeah. And that's still the case?
Yes, it is.
Yeah. Right, Chair.
Okay, Kieran, thank you, and thank you both.
May I comment on that, Chair?
Sure,
Just
yes.
to say, the point about a year lost, from a professional perspective, I don't believe we've lost the year. Yes, it would be better if we were in a position where we had direct access, and Dean has described some of that. But we had a very robust planning process in place, and we have worked very hard over the last number of months with key stakeholders to get ready to implement direct access physio. So none of that work has actually been lost. I would say we're pretty much ready to hit the button on it. Dean has had some discussion earlier around some metrics around perhaps prescribing costs, etc., which aren't currently included in the project, but all of the rest is ready.
Well, I'm glad to hear that, but I go back to the fact that the Minister told the Assembly in March 2014 who in actual fact is making who is making the decisions in the department.
Well, ultimately the Minister leads the department.
Well, it hasn't borne out within the last year, and we're still sitting where we were this time last year.
Well, I think for the reasons we've described, we're not sitting where we were this time last year. We hadn't identified a preferred provider this time last year. We hadn't engaged with GPs, AHPs and other practitioners this time last year. We didn't have the pilot substantially worked up. We have all of those things now.
We look forward to.
There was public statements issued on this scheme about to start. That's how ready it was. Okay. So look.
thank you both. I think you've heard fairly vocally the support for the pilot and the confusion and lack of clarity as to why we've had to come along this journey. I'm taking you, Dean, at face value in this. I would expect that we would get the report as requested before the end of the month in terms of the timelines, in terms of reference, etc., and rollout. And we look forward to getting that information from you. Thank you both for your time.
Thank you, Chair.
I'm putting it down in my diary. May of 2015. This
Mine, Mr. McCarthy, as well.
All right, it's in my diary.
You put it in your diary. I'm going for physio. Okay, members. Thank you. And I'm going to move on because I know some of the members have to leave at 5, so I'm going to try and get through this as quickly as I can. Item 6 is an SR. It's a misuse of drugs regulations 2015. It's on page 39 of your meeting pack. We had considered and approved ASL1 for the rule on the 11th of February. It was submitted to the committee, and the examiner of statutory rules has nothing to report to our members' content.
Right.
If so, the Committee for Health, Social Services and Public Safety has considered the misuse of drugs regulations and has no objection to the rule.
Right.
Item 7 is the misuse of drugs designation amendment order 2015, which is on page 47 of your meeting pack. Again, we had considered and approved this on the 11th of February. There have been no changes to the policy content since the SL1 was submitted to the committee, and the examiner of statutory rules has nothing to report on the SR, which is subject to negative resolution. Are members content?
Right.
If so, the Committee for Health, Social Services and Public Safety has considered the misuse of drugs order and has no objection to the rule. Item 8, the Health and Personal Social Services, Health and Social Care Amendment Regulations, page 56 of your meeting pack. Again, we had considered and approved the SL1 for this rule at our meeting on the 11th of February. There's been no changes to the policy content since it was submitted, and the examiner of statutory rules has nothing to report, which on the SR, which is subject to negative resolution. Are members content?
Great.
Therefore, the Committee for Health, Social Services and Public Safety has considered the Health and Personal Social Services, Superannuation, Health and Social Care and has no objection to the rule. Item 9 is an SL1, page 67 of your meeting pack, which is the Health and Social Care Pension Scheme Regulations. The relevant papers are on page 67. The statutory rule is required to implement the new HSE pension scheme arrangements from the 1st of April 2015. Are members content that the Department makes a statutory rule?
Great.
And item 10 is an SL1, the Health and Social Care Pension Scheme, 2015, page 73 of the meeting pack for the relevant papers. The statutory rule is required to implement the new HSE pension scheme arrangements from the 1st of April 2015. Are members content that the Department makes a statutory rule?
Great.
And item 11 is an SL1, the Health and Personal Social Services Superannuation Scheme and Additional Voluntary Contributions, page 78 of your meeting pack. Statutory rule is required again to implement the new HSE pension scheme arrangements from the 1st of April 2015. Are members content that the Department makes a statutory rule?
Great.
And item 12 is an SL1, the Health Service Cross-Border Healthcare Regulations. Referring members to page 84 of the meeting pack for the relevant papers. The statutory rule will implement outstanding aspects of the EU directive in relation to recognition of prescriptions across EU states. Are members content that the Department makes a statutory rule?
Great.
Okay, item 13 is the Forward Work Programme. Members, asking you to note that, but also request an agreement that we ask the Minister to attend next week's evidence session, which has been scheduled on the budget, but I think specifically to answer the questions around the pharmaceutical price regulation scheme. He wasn't available last week, but I do think it's appropriate that we would invite the Minister to that evidence session next week, so we can get a members' agreement on that.
Great.
Item 14 is matters arising. There are 6 items under matters arising. Again, in the interest of time, I just want to draw attention to several of them. Page 95, 96 and 106 are items in relation to the Committee's review of the Department's Benefits Management Framework for TYC.
Are members content to proceed as suggested in the clerk's memo?
Agreed.
Great.
Thank you. Page 153 is a paper from OECD on the key areas of public governance review they're undertaking on behalf of DFP. A meeting was held with a number of committee chairs on the 23rd of February. I wasn't able to attend the meeting, so it's suggested that as a committee we would send a short submission to the OECD review team. If there's any particular issues that members would like to raise in relation to public governance review, please do so. I am suggesting that we make a number of points around, first of all, the theme of early intervention and prevention. I think there needs to be a greater emphasis on translating this from a policy aspiration to a policy that's backed up with sufficient funding. Correct. I think it's important that we reflect on the policy direction and its separation that has been pointed up to us in various evidence sessions from actually allocation of funding. There also needs to be a greater emphasis on preventative spend, and the fact that spending on public health is classified as discretionary spend at present, I think needs to be looked at. So are members content at this point to issue a submission based on these general themes?
Yeah, great.
Okay, 15 is correspondence. There's 11 items. Again, just drawing your attention to several of them. Page 224 is correspondence from Kinship Care requesting a meeting with the committee. Are members content to invite them to the next stakeholder event?
Great.
Page 225 is correspondence from CPL Industries requesting a meeting with the chair. Just advising members that the organisation has already been invited to the next stakeholders event. Yep. Page 227 is correspondence from Mr Larmour regarding changes to legislation around child protection. Again, reminding members that the committee considered this correspondence on the same issue at our meeting on the 4th of February and advised him to contact his local representatives for support. So I'm suggesting that we just reiterate that advice.
Great.
Item 16 is any other business?
A couple, Mr.
Sorry,
Chair.
Paula first.
Oh, sorry, yeah.
It was just to, I should have done it before we looked at the items 8 through to 11 and declaring interest as a member of the Health Service Superannuation Scheme.
Okay, thank you. And Kieran?
Yeah, 2-1. Good news. You may have heard it as chair. Do you remember the concern we all expressed in relation to the Independent Living Fund? I've got information that the Minister has in fact listened to the respondents and has opted for option 2. Have you been made aware of that? Well, it's good news anyway. And the second one is not so good news, and that is, I heard, I'm sure other members did, the plight of a mother with his son drug addiction. You mentioned drugs there. That there was not sufficient beds in Northern Ireland to look after. Could the committee write for an update on the facilities and what is available for? I mean, it's tragic circumstances where the family could not get service for her drug. The son that was addicted to drugs. And I think, it's a shortage of beds and facilities. If the committee could ascertain exactly what is available for, because it could happen to anybody. It's happened to any of us.
I think, first of all, in terms of the Independent Living Fund, we should seek an update from the Department and the Minister as to how that will be rolled out or move forward.
Well, yeah, I would expect that the Minister will probably make a statement in the Assembly.
But we can still seek clarification. Secondly, in terms of addiction generally, and I had taken a delegation from North West Addiction Task Force to the Minister on this very issue a number of weeks ago. I think increasingly there is an issue about access to services for inpatient for under 18s.
Yeah.
And it is proven extremely difficult to even ascertain the picture, if you like. But I know that even since that meeting, there was 3 other cases of a similar vein. We have written to the Minister following the commissioning plan representation and the very fact that addiction services, or the target around addiction services, has been removed. I would suggest, Kieran, that we take this directly up with the Department and the Minister when they're in next week.
Right, that's
and I think
fine,
we can, because we have that in writing to them.
And I just wondered, and it was exactly on that, and I couldn't agree more with you. And when we look at addiction right across the board, whether it's under 18 or whether it's adult addiction, there are so few facilities in Northern Ireland. And I know of one, because I've actually been down to it with someone else in Uri, at Sister Concedia's down there, which is fabulous and amazing place. But it's only one of so few that we have. And this is a problem that is going to increase and increase, because we've seen the addiction increase in our country. So it is something that needs to be addressed, and I agree with everything that you had said, Chair, that does need to be brought back on the agenda.
Okay, thank you. And Fergal?
Yes, Chair, this relates to a recent health service tender around relationship counselling, which was decided on last week. And the issue goes much wider than that. The issue of the tender is around, as I say, relationship counselling, and there were two companies or organisations bidding into it. Accord and Relate NI, and Relate NI won the contract. Accord had an issue about even applying for the contract and what it would do with it if it won it, because the contract changed the terminology around parenting. And of course Accord is a faith-based organisation, so this does touch on that wider issue of conscience, which is forming something of a public narrative. But my concern is that in the immediate term is that up until this point the contracts have been awarded through trusts, so various organisations could avail of business, if you like, and form. An Accord has been going now for 60 years, or certainly more than 50 years. But the department then took all of the contracts together and formed it into one, and now Accord has lost. And it has lost because the department has taken a stance on an issue which is still being debated in the public, but it has taken a position which has changed the concept of what goes to the centre of this without debate, if you like. So what I'm wondering is, can the committee write to the department asking how it arrived at the contract, what consultations it did, and perhaps even invite in some of those who were associated with the contract, so that we can maybe look at this. The debate has to be had. I'm not taking positions, or not asking anybody here to take positions on that at this point. I'm merely reflecting on the fact that the position the department took, if you like, leapfrogs the public debate, or happens ahead of the public.
I mean, I'm happy enough that in the first instance we write to the department to seek clarification on, you know, the not even the position, but a position that's been debated.
Yes.
And how this process was arrived at.
How that process was arrived at. I don't know what it means for the contract itself, and that's where I'm asking committee support to look at it, so that we can see where this goes. It would be a shame that a faith-based organisation like this, with such experience, now finds itself, by virtue of how the contracts were changed, how it would find itself effectively out of business. And, you know, I don't think that's acceptable, especially when the wider debate has not been had.
I think there's the other question, just to come in on the back of that, as to why things were changed to become one tender. Because we find this actually with various different things, and the people have lobbied us not just to do with this, but other things, where the department are starting to change their tendering process and looking at one organisation to do. And in my experience, working especially within the women's sector, they all have their own specialties, they all have their own different things they bring to the table. So they actually look at, we need to ask why they decided just to choose one. And I know the one that they've chosen are highly reputable and are a fantastic organisation. I can't detract from that. But that's another issue as to why they've changed that type of tendering. And
also, I'm not negative reflecting on those that won the contract, and neither do I know the scoring of what happened within the contract. But that's also
it's the process.
Issue. It's the process. Yeah. Okay. And really what one could argue from the faith-based organisation's view is that the goalposts were shifted and they were put out of business.
Okay, well look, if members are in agreement, we would write to the department with all those caveats that this isn't about the organisation that were awarded the contract or any such judgment. It's about the process and about a debate that is still taking place. Absolutely. And how this was reached. Okay?
Okay, thank you.
Okay, members, date and time, place of next meeting is Wednesday the 11th of March, 2 o'clock in the Senate. Thank you.